We can't hear you. Can you hear us? Hunter, can you hear us? Can you say something, Hunter?
Can you hear me now? There we go.
Yes.
Yes.
Oh,
Good job.
there we go. It was working just fine until I had to MC, and now it's not working. Okay. Welcome, everyone, from the coffee hour. You're all here now. Hi, everyone. I'm Hunter Jones, the Extreme Heat Risk Initiative Program Manager in NOAA's Climate Program Office and your MC for the day. Welcome to day 3 of the NIHHIS National meeting. If you are rejoining us, welcome back. And if you're just now joining us, and I saw a few people in the chat who are, welcome. You'll be happy to know that the recordings of days 1, 2, and 3 will all be available on the NIHHIS site. And I know I plan on going back and rewatching some of the sessions from the past 2 days because they were so informative. Just a few administrative notes, of course. The meeting is being recorded. Please keep your mics on mute, but not me. I probably shouldn't have done that. And your cameras off for the duration of the meeting, unless you are presenting. Live transcription is available. You may have to click the More button at the bottom of the Zoom screen to get there. Please feel free to use the chat for Q&A, for sharing resources, etc. But please keep it on topic. After starting the conference in a sprint on Tuesday with an impressive array of speakers who are leaders on heat and health, we moved into Wednesday, yesterday, with determination to go deeper and understand how communities are experiencing heat risk and what can be done to keep them safe. Yesterday, after a stimulating coffee hour discussion on indicators, keynotes by Deputy Administrator McCabe of EPA and Associate Administrator Salinas at FEMA, we heard a firsthand account of the tragic impacts of extreme heat in the Pacific Northwest. The loss of life and suffering experienced in Seattle, Portland, and in other cities and counties throughout the region was preventable, is preventable. And after discussions from that session, I truly hope we can help communities everywhere across America and around the world plan and prepare for extreme events that have been charged up by climate change to avoid great loss of life in the future. Our second panel of the day, yesterday, we considered the cascading impacts of heat with an opening presentation by Vicky Arroyo of EPA. The presentations in this session were simultaneously wide-ranging and deep in their coverage, and though in this meeting we've heard a lot of examples of how terrible the impacts of heat can be, I found the session to be uplifting because knowledge is power, and the resources and information shared by ASPR, SAMHSA, CDC, DOT, as well as local health departments and academics who study heat's impact during power outages, all indicated to me that we have great evidence for taking action and reducing the burdens of extreme heat. We wrapped up the day yesterday with insightful presentations on communicating heat risk, a closing keynote with international perspective by Dr. Joy Shoemake of the WHO-WMO Climate and Health Joint Office, also the host of today's coffee hour, and a networking session hosted by ASTO, NACCHO, and the GeoHealth Community of Practice. Today, our final day together in the NIHHIS National meeting, we explore how to build equitable human resilience to extreme heat. You can look forward to sessions focused on heat-safe housing, a hands-on urban heat island training session, a close look at how Osha and others are protecting workers from heat, a discussion on making outdoor athletics and recreation safer, a crowdsourcing moment to hear from you on visions for a heat-safe future, and finally, a sneak preview of the draft NIHHIS Strategic Plan, which is currently under development. But before we get to any of that, I would like to turn the microphone over to Lynn Owens, Safety and Occupational Health Specialist with the Occupational Safety and Health Administration, to introduce our next distinguished speaker. Lynn, the floor is yours.
Thank you, Hunter. Good afternoon, everyone. It is with great pleasure that I introduce Mr. Doug Parker, the Assistant Secretary of Labor for Occupational Safety and Health. Doug Parker was sworn in as Assistant Secretary of Labor on November 3rd, 2021. He previously served in the Obama administration as Deputy Assistant Secretary for Policy in the Department of Labor's Mine Safety and Health Administration, and was a member of the Biden-Harris transition team focused on worker health and safety issues. He most recently served as Chief of California's Division of Occupational Safety and Health a position he held since 2019. Prior to his appointment at Cal OSHA, Doug was Executive Director of WorkSafe, an Oakland, California-based legal services provider. Doug earned a JD from the University of Virginia School of Law and a BA in history from James Madison University. He is married and has 2 daughters. Mr. Parker is originally from Bluefield, West Virginia, and grew up in Lynchburg, Virginia. Thank you.
Hello, and thank you for being part of this inaugural meeting of NIHHIS. We know that extreme heat's effects on people and communities are getting progressively worse because of the impact of climate change. We also know that excessive heat leads to heat stroke and death, including in workers. Existing health issues like asthma and heart and kidney diseases are also made worse because of excessive heat. The Bureau of Labor Statistics reports an average of 38 documented worker deaths from heat each year between 2011 and 2019. As tragic as this number is, we realize that it is an undercount because of underreporting and because heat is sometimes not documented or recognized as a cause or contributing factor to deaths resulting from heart attacks or strokes. In addition to deaths, there were an annual average of 3,500 documented cases of workers with days away from work due to heat-related illness. We know that in addition to the physical hazards of excessive heat, the physical risks also intensify socioeconomic and racial inequalities in America because workers of color are disproportionately in jobs where they are exposed to high levels of heat. There are also significant economic impacts for both workers and businesses. Because of all of this, protecting workers from heat hazards is both critically important and extremely urgent. That is why I am excited that we are gaining momentum in this effort. Vice President Harris recently announced OSHA's National Emphasis Program on heat. This NEP will target 70 high-risk industries and will focus agency resources and staff time on outreach and education as well as on heat inspections. And through this NEP, OSHA will be able, for the first time, to proactively inspect workplaces for heat-related hazards before workers suffer preventable injuries, illnesses, or death. Next week, on May 3rd, we are holding a public heat stakeholder forum to discuss this topic further. More than 2,000 people are registered to attend this event. In February, the National Advisory Committee on Occupational Safety and Health convened a heat working group that brings together experts from several industries and from government. We have initiated rulemaking to develop a heat-specific workplace standard. We published an advance notice of proposed rulemaking last October to get early feedback on the architecture of a proposed rule, and we are now reviewing the public input that we received. All of the information we receive from the working group, from our public forums, and through the advance notice of proposed rulemaking will be valuable as we work to protect workers. Of course, as we develop new tools to protect workers, we continue to update our heat illness prevention campaign, which has provided educational and training materials to both employers and workers for more than 10 years. With feedback from our stakeholders over the years, we have been able to update those materials to be more inclusive and effective. We now produce materials in a growing number of languages and formats. We have used that input to make our materials more effective by providing practical information on how to handle heat emergencies in a range of industries and situations. I have to recognize that today is Worker Memorial Day. It is a day where we pause to remember those who lost their lives on the job. Nearly 5,000 workers died in 2020 because of work-related hazards. That is an average of 13 work-related fatalities every day of the year. One of the things I do each week is sign condolence letters for families who lost someone they love to a preventable workplace fatality. Each letter begins, "Please accept my heartfelt condolences," followed by the words, "for your husband, your son, your daughter, your mother, your uncle, su esposo, su hermano." I read each of their names and I sign each letter because it is important not to see these thousands of workplace deaths each year as statistics, but as people who are being missed and grieved by the families they've left behind. On Workers' Memorial Day, we pause to join families and loved ones in remembering and honoring the people they've lost. The fact is, every day is a day of memorial and remembrance for many families because 13 workers die each day from work-related injuries. So while we remember those who were lost, we also need to reflect on the work we do and how we can do it better so that others don't have to suffer such unbearable pain. If you ask people what they value most, what's most important to them, health and safety for themselves and for their families is at the top of the list. Health and safety for ourselves and our families is a core value that is ingrained in our lives. We must do all that we can to make sure that worker health and safety is a core value in every workplace in America. We should expect, even demand, that our workplaces are safe and healthy in the same way that we expect water to be safe to drink and air clean to breathe. For us at OSHA, health and safety is not only a core principle, it is the reason we exist. What we do protects people. It keeps families intact and strengthens our communities through the work we do in workplaces across the country. We know, though, that in too many workplaces, health and safety is not a core principle lived every day in how work is planned and supervised and performed. Workers die, they're injured, and get sick every day because they are needlessly exposed to hazards on the job, from heat to other long-standing hazards like falls and exposures to dangerous chemicals. Workers are too often put at unnecessary risk just to do their jobs. While great strides have been made over the last 51 years since the OSHA Act was passed, we know that there is still much work to be done. That is why I appreciate your investment in this topic of heat. Heat is not just a summertime hazard, and it is not restricted to naturally warm climates. Heat hazards are everywhere throughout the country all year long, both outdoors and indoors. It affects workers of all ages, genders, and ethnicities. We have to do all that is necessary to protect all working people from preventable death and illness caused by heat. OSHA has been a federal partner agency of NIHHIS since its inception in 2015. Over the past 7 years, OSHA has worked with NIHHIS partner agencies on a number of projects related to health and heat, including interagency heat safety communications efforts, a paper on activity modification guidelines, developing the NIHHIS portal, and more. I want to thank each of our public and private sector partners from government, academia, and community leaders for their work on this and for sharing their expertise. OSHA is committed to working with and learning from our federal partners involved in NIHHIS to protect workers from heat. We are all better off for it. The information and ideas shared over the course of these 3 days will go a long way towards helping us work together to better protect workers from the dangers of extreme heat. The time to act is now, and I am grateful for your help. Thank you.
And thank you so much to our colleagues from OSHA, Assistant Secretary Parker, for those thoughtful and powerful remarks, setting the tone for the interesting discussions to follow throughout the day. From here, we will move into our first session to learn how we can provide heat-safe housing for all. I would like to introduce our moderator, Dr. Shubayu Saha, currently Senior Advisor to the Office of Climate Change and Health Equity at the Department of Health and Human Services, on detail from the Climate and Health Program at the Centers for Disease Control and Prevention. Shubayu, the floor is yours.
Thanks so much, Hunter. Can you hear me well?
Yes, we can.
Greetings, everyone. Welcome to the first session on day 3 of the NIHHIS meeting. If the last 2 days of the meeting have been a trove of useful information and learning opportunities, day 3 promises to be the same, if not better. In this particular session, we are going to discuss heat, health, safety issues at home. If you are wondering about the need to bring up this topic at this meeting, I would use two startling examples that were presented yesterday at this meeting as justification. Colleagues from the National Highway Traffic Safety Administration showed that an overwhelming majority of EMS calls associated with heat exposure were for individuals in their residences. In the same panel, colleagues from CDC and Georgia Tech presented on the drastic differences in indoor air temperatures by housing type, which becomes very critical for those living in those homes without resources for adequate cooling. So members of this particular panel bring expertise from building design and resilience planning, decision makers at the federal and city governments, and policymaking to share wide-ranging insights for us to learn from. So each panelist will first make short remarks on the salience of the issue from their perspectives, and we'll open up the floor for Q&A after that. So without further ado, I will introduce the first panelist. Dr. Janice Barnes, founder of Climate Adaptation Partners, focuses on planning, advocacy, and partnership building for climate adaptation. With technical training in architecture and organizational behavior, she helps clients to critically evaluate their possible adaptation pathways given current and expected exposures, and link these to appropriate design and financing or funding options. Working from the intersection of climate change and public health, Janice links environmental, social, and economic indicators to advance resilience principles and connect knowledge across communities. Janice, the floor is yours.
Thank you so much. And thanks to everyone for the opportunity to bring this group together. I have learned so much in the last few days and really grateful for the opportunity to continue to do so through the network that's been created. The remarks that I'd like to share to start this conversation have to do with this intersection of public health and climate change. And we've developed something of a model called ACMA. That acronym stands for Awareness, Coping, Mitigation, and Adaptation. And the intent of that is to raise up in parallel the degree to which individuals, communities are aware of issues like heat health risk, have access to coping resources, are in the process or have the ability to mitigate to some degree the hazard of heat, and understand what the long view of adaptation planning actually means. And when we think about that, we think about it in terms of nested scales. And by that, we mean the nested scales of governance, what's happening at a national, a state, or local level, the community, the household, down to the individual, very similar to some of the NIH models that look at impacts. And this is relevant in terms of heat to the point of raising up the risk awareness, which we've talked a great deal about over the last few days, but also in parallel doing kind of an environmental scan, looking carefully at the availability of resources to connect to individual community awareness. So what resources, what coping resources are truly available or could be created within communities without a significant lift? And in understanding those coping resources, thinking about where the interventions to even improve them, amplify them, expand them actually are. And then thinking even more carefully about the interrelationships of such resources with larger hazard mitigation efforts. We refer to water and more frequently than not, just recognizing the opportunities for stormwater management to also potentially deal with heat, depending on what we're doing. And then asking ourselves who the key actors are. If you think of a RACI diagram, who are the broader network of collaborators who need to be brought together there to truly create a transdisciplinary effort on heat and health. And lastly, as we're looking at this in terms of these nested scales and in terms of what we're doing in awareness, coping, mitigation, and adaptation, how are we making this accessible to community members, to individuals who don't work in this space? Thank you.
Thank you so much, Janice. I would request Tom Phillips as our next panelist to make his remarks. Tom Phillips is a consultant on healthy sustainable buildings at Healthy Building Research in Davis, California, and a visiting researcher at the California Department of Public Health. He has focused on climate resilience, adaptation, and mitigation in buildings and communities since 2011, especially on extreme heat, health, productivity, and non-energy benefits of energy efficiency. Current projects include assessing and preventing overheating of buildings under heat waves, power outages, and future climates. Tom was the lead author of Climate Adaptation and Resilience Criteria for the US and California Sustainable School Design. Tom worked for over 3 decades on indoor environmental quality and health risk reduction at California's air pollution and energy agencies. Tom, your floor is yours.
Hi, Steve.
Okay.
Hold on. Let me stop the meeting that I'm in.
Hi, are we on? Can you hear me?
Hi. I have to stop the meeting because that's going on in the background. Let's see. I have to stop the meeting that's going on in the background right now. Otherwise, I won't be able to hear you.
Oh,
Okay.
no.
I think we can
Hi.
hear you, Tom, but there was this, somebody else speaking that was
Okay.
interfering.
Okay, I guess we're on. Thank you so much for inviting me to this meeting with these distinguished panelists. I'm also very thankful to see this integrated federal effort and international effort after so many years of seeing these problems continue and grow in terms of extreme heat and outages and wildfires and then now the pandemic. I'm speaking from the ancestral home of the Wintun tribe in Northern California, where it gets pretty hot. But we have a lot of shade trees and we have some efficient homes here. And I just wanted to make, I guess, a few key overall points to start with is that we know enough now to adapt our buildings to extreme heat in future climate conditions and outages and urban heat island. And it's being done. There's the tools there. It's fairly straightforward, not very hard. And it's time to do it now in new and existing buildings, and it can be done cost effectively. And we can't wait 3 years for the building cycle to update and do these little increments. And we know in California, for example, in many hot areas, the indoor deaths accounted for about 2/3 of the heat wave deaths in 2006 here in California, even on the coastal areas that are much cooler because the housing and the AC were not adapted to these extreme temperatures, and humidity is adding to the problem in many areas. The other point I wanted to make is that we've heard a lot about shade trees and cool pavement, but I have not seen great data on that, and that is kind of a slow moving effect, and we need to act now. The models I've seen look at indoor and outdoor measures, and the indoor measures tend to be much more effective, and of course you get immediate benefits. So we need an integrated, optimized approach to look at all these measures. And then I guess finally, I think we need to take advantage of opportunities in retrofit weatherization programs to add on these climate resilient measures for future climate and beef up the passive cooling measures. And that can be very cost effective because we already have the people in the field working on the buildings. And so thank you very much.
Thanks so much, Tom. The next speaker would be Holly Ravelsloot. Holly serves in the Office of Community Services, Administration for Children and Families at HHS, where she provides leadership over data and data visualizations for 6 social service and community development programs, including the recently launched Extreme Heat Dashboard on Earth Day 2022. She serves as the Low-Income Home Energy Assistance Program lead for policy and evaluation, leading the public launch of the Liheap Performance Management Data Warehouse, a website providing public access to data and analytic tools. She has also worked at the Department of Energy's Weatherization Assistance Program as a policy and operations lead, providing technical assistance to grant recipients implementing this low-income residential retrofit program. Holly, over to you.
I am
Holly, are
so
you on
sorry.
mute?
I
Yep.
am on mute. My
Yep.
apologies.
That's
Thank
all
you,
right.
Dr. Saha, and for the introduction, and thank you for inviting me to be part of this panel. As Dr. Saha indicated, I am in the Office of Community Services, and one of the programs that we have to address extreme heat is the Low Income Home Energy Assistance Program, also known as Liheap. Since 1981, Liheap has been providing critical energy assistance to those most in need. Eligible households for Liheap receive benefits on heating, cooling, crisis assistance, weatherization assistance to ensure that eligible populations are able to maintain safe indoor temperatures. We serve over 5 million households annually, and Liheap is considered a lifeline to many individuals and families who face shutoffs or have unmanageable energy bill arrears. We know the threat of extreme weather is disproportionately felt by communities of color, lower income households, and vulnerable populations, as they are more likely to live in urban heat islands and are often unable to afford adequate air conditioning. So it is particularly important as we prepare to enter a summer that is predicted to have above normal temperatures, that we provide our grant recipients information needed to help families and individuals stay safe and healthy during these times. To that end, the Office of Community Services has been deploying a multi-pronged strategy to ensure that our state, territory, and tribal partners have the resources and tools they need to support households as we continue to address climate change and extreme weather. In addition to providing guidance on funding flexibilities to Liheap grant recipients to mitigate extreme weather, the Office of Community Services released, as Dr. Saha mentioned, a new heat stress GIS dashboard to help stakeholders and Liheap grant recipients visualize the impact of extreme heat across the country and how Liheap can be used to mitigate the impact of heat stress on households. My colleague, who is also on the call, is going to drop that link in the chat so you guys can feel free to check out that dashboard. Also, in May, the Office of Community Services is holding 2 public webinars. One will feature climate change heat stress experts from across the country to discuss the impact of extreme heat on low-income communities. And the second webinar will feature Liheap grant recipients and highlight how they have used block grant flexibilities to address heat stress. At OCS, we want to ensure our households are able to maintain safe, healthy indoor temperatures. I look forward to the Q&A later in this panel. Thank you.
Thank you so much, Holly. The next speaker would be Dr. Dave Hondula. He is the Director of Heat Response and Mitigation for the City of Phoenix in Arizona. In that role, David helps lead and coordinate programs that aim to protect people from dangerous summer heat and implement strategies to cool the city and make it more comfortable. David joined the city in October 2021 to spearhead the nation's first publicly funded Municipal Office of Heat Response and Mitigation, created as part of Phoenix' $2.8 million City Council approved climate and heat readiness investment. David, the floor is yours.
Well, thank you, Shubayu, and good morning, everyone. And thanks so much for the meeting organizers for what I assume many would agree has been a great 3 days of conversation, will be a great 3 days. And so happy to be a part of this panel. I suspect many of my colleagues on the panel would agree that the heat problem is largely a housing problem. We see that very clearly in the data here in the Phoenix metropolitan area. The heat problem is a housing problem because we don't have enough housing right now. And the housing that we do have isn't affordable enough for enough people. Last summer, unfortunately, here about 2/3 of our heat-associated deaths were among individuals experiencing homelessness. And as we've seen those numbers increase, the number of unsheltered people on the streets go up. We're fearful of what is ahead for this summer, a 30% increase in our point in time count, for example, in the number of unsheltered individuals. So I think although some of us come from climate backgrounds and public health backgrounds, engineering backgrounds, I think we all need to be doing what we can to advance the housing conversation and the housing affordability conversation. I think that can really strengthen our community resilience. Aside from the unsheltered challenges, thinking about homes and housing, Holly, so happy to be on the panel with you. We know here in Phoenix and indeed across the country, that demand for your programs and the broader suite of programs that help weatherize and provide energy assistance, demand extremely exceeds supply. There are also some restrictions and some challenges in how these programs are implemented at the local scale that I'm not sure are quite optimizing the way that the programs are. I'm not sure that we are optimally meeting community demand. For example, at least in our area, some of these programs still operate with a sense of first come, first serve. And we know that some of the folks most in need may not be able to get to the front of the line. I'm concerned as we look ahead to this summer about some of the supply chain challenges and labor market constraints, thinking in particular about getting air conditioners repaired in a timely manner. And here in Arizona, we will have an interesting situation ahead of us this summer. The State Corporation Commission enacted new rules regarding utility disconnections, which cover most but not all of the state utilities. So of the 1.6 million residents of the city of Phoenix, some of them this summer will be under one set of rules where utility disconnections are prohibited between June 1st and October 15th. And for others, utility disconnections will be prohibited on days when the National Weather Service has an excessive heat warning in effect. And clearly those are two very different sets of days that customers will need to be aware of. And I hate to say it, but for some customers, not even clear who their electricity provider is, let alone understanding how to navigate these rules. So those are some of the challenges we're looking ahead toward this summer here in Phoenix. So thankful to be a part of the panel, and thanks for convening us, Shubayu.
Thank you so much, Dave. We'll next hear from, Council Member Tom Hucker. He was first elected to the Montgomery County Council in November of 2014. He is the chair of the council's Transportation and Environment Committee and also serves on the Public Safety Committee. He is one of two Montgomery County representatives on the board of the directors of the Metropolitan Washington Council of Governments. He serves as the vice chair of the Washington Suburban Transit Commission. As a state legislator, council member successfully authored and passed over 40 laws, including groundbreaking living wage requirements, children's health initiatives, employee discrimination protections, wind energy expansion, and other environmental reforms. While serving on the county council, he has championed initiatives that have removed lead from school drinking water fountains, improved public transit, expanded solar energy, increased attainable housing and home ownership options, and transformed policy. Councilmember Tom, please.
Thanks so much, Shubayu, and thanks for everyone for having me. It's great. It's an honor to be here with so many distinguished speakers. And thanks for the generous introduction. So I serve on the County Council, Montgomery County, Maryland. If you don't know Montgomery County, we're about 1 million people just north and adjacent to Washington, D.C. As was said, before that, I spent, before the 8 years I've spent on the council, I spent 8 years in the Maryland General Assembly looking at a lot of similar issues. And before that, I was a community organizer, running my own nonprofit that did a lot of work on tenant issues, which sort of led me to the issue I want to talk to you about. Obviously, summer's just around the corner. And many of us will be thinking about vacations and trips to the beach and other happy thoughts like that. But we have 300,000 tenants in Montgomery County, and many of them are in unsafe housing that overheat and are not properly climate controlled with working air conditioning. We've seen across the state every summer that we're breaking records. July 2021 was the hottest month ever recorded. And with the increasing pace of climate change and the more frequent and intense heat waves that we've been having in the mid-Atlantic here, having air conditioning is not just a comfort issue, it's really become a life or death issue. Our housing codes, like housing codes across the country, have for many years included a requirement for landlords to provide heat in the winter because that's a life or death issue. I really would believe we need to think of air conditioning in the same way. We've lost too many of our particularly senior citizens in unsafe housing without air conditioning. So in Montgomery County, I began hearing from a number of constituents who either didn't have air conditioning or had failing air conditioning and whose landlords weren't maintaining it. And when I brought this to the attention of our housing department, I learned, of course, no surprise, they don't even track which housing has air conditioning, and they had no enforcement mechanism to make landlords ensure that their air conditioning was functioning because it wasn't required by the housing code. So I introduced legislation a couple of years ago to require working air conditioning in every unit. we required it specifically. We debated all the details. We specifically require it now from June 1st to September 30th. There's very few jurisdictions around the country that do, to my surprise. We were the first in our region to do that, and I'm glad DC passed a similar law like that after mine. But I believe we need more bills like that in communities across the country. We're taking dozens of different steps to combat climate change. But while we're doing that, we have to get serious about climate adaptation as well, and preparing our residents and our building stock for severe weather. And requiring air conditioning from our landlords is just one part of that. So I'm thrilled we're talking about this issue at such a critical time before the summer heat is upon us. And again, grateful to be part of such an esteemed panel. Thank you all for putting this together, and I'm eager to hearing more discussion and sticking around for any questions. Thank you.
So much, Council Member, and everybody else for your remarks. So we'll open the session for discussion, and I request all panel members to turn your videos on, please. Also request the audience to continue to send in questions, and if need be, identify the panelists that you would like to hear from as you submit those questions. I will, Council Member, we can't see you. There we go.
Sorry. I apologize. I'm in my car, but I'm listening.
That's okay. We really appreciate your time. I would start a question, for Janice. Could you share any information on any innovative programs with practical examples that can improve the ability to safely shelter at home?
Certainly, and thank you. I think there are really 5 pieces to think about here. 1, how do you reduce your exposure, your external exposure to heat gain? 2, how do you reduce the amount of internal heat that you generate? 3, how do you reduce the area that you have to manage? 4, how can you reduce your own personal temperature? And 5, what's your backup plan if you need some help? So in each one of those, maybe just an example or so. So we think about the external exposures, and Tom will certainly share thoughts about this as well. We want to first think about keeping as much exposure off your home as possible. So everything from shading to thinking about weatherization, thinking about managing the breezes that you can access, and even thinking about your material choices. There's an excellent example in the Keep Safe program the Enterprise Community Partners put together following Hurricane Maria. Keep Safe has a particular section that focuses on passive habitability. And as we were developing that under Lori Showman's guidance, the whole team, we talked about if you only have a few $100s to spend or not very much at all, what are the kinds of things that you can do to make a difference at home? So I'd encourage you to look up Keep Safe. That's now starting to replicate in Florida and elsewhere. When we think about the issue of reducing the generation of, let me back up for a second. Also on weatherization, I think there are some really innovative products coming out. So Soul Cold out of Tel Aviv is a very interesting new product. It's a film that can actually reduce the amount of heat gain that your home or even your car picks up. I would have a look at Soul Cold. And then New York City's Cool Neighborhoods program, which has, I think, been discussed a couple of times over the last few days. The Cool Roofs program is innovative because it encourages corporations looking to contribute to social responsibility to participate in the roof coatings program. So it's a way to get help without having to dig into your pocket, particularly if you're stuck a bit. And then on the weatherization, the Sustainability Institute in Charleston is doing some really interesting work with seniors to help them when they are not really able to help themselves to weatherize their homes. So I would look them up as well. When it comes to the generation of internal heat, I think NREL has some really good resources. Everything from the way that you prepare food to the appliances you use to switching to LED lighting. I think one of the things that jumped out to me was just the idea of separating your water heater if you have an older traditional water heater from the common area of your home, or switching to a heat on demand resource. Also in Tel Aviv, there's an interesting example of moving the water heater outside and make it solar generated heat in order to reduce that demand. when we talk about reducing the area to manage, that's really moving from what you might consider as a fully cooled home to a selectively cooled home to even a partially cooled home, where you're raising the base temperature from what might be normal to what is survivable, but not necessarily in those low 70 degrees that we sometimes see. And I think that scale issue is an important one here. And I see something in the chat where we might be able to talk about that with Tom as well. Reducing your own temperature, that's everything from reducing the activities that you're doing in peak heat times to recognizing what you're wearing. And we've talked about that a little bit over the last few days. Thinking about what you're consuming, like less alcohol, less food, smaller meals, so that your body's not heating up quite so much, and thinking about hydration and cooling points on your body. And I think Seattle's King County has a really interesting resource called Keep Safe in the Heat that actually uses comics to communicate to community members using different cultural norms on ways to cool the body. And then lastly, the belt and suspenders, right? So if none of those are really working, what's your backup plan? We talked about Be a Buddy the other day. And I think that we just need to make sure that we see ourselves, certainly an individual in the family, but we are part of a network of collective good that could happen if we can find a way to check on one another and also understand where other community resources, kind of like that Acma model, what are my resources if what I can do at home just isn't sufficient for the situation. So that's trying to make every spend count.
Thank you so much, Janice. If I could ask, Tom Phillips, maybe to sort of reflect on that same question, what are some practical examples that you might share with the audience in terms of how to safely shelter at home, and, maybe any insights from the work that you have been doing on, overheating mitigation policies in buildings. And Tom, you're on mute.
Oh, sorry. Okay, well, I was actually, asked to look at the examples of how to prevent overheating. I focused on kind of the long-term issues. The short-term solutions are very similar in terms of, as Janice mentioned, reducing how much the sun is beating on your house, and shading is the first line of defense. You can plant quick-growing vines like string beans. I did that years ago on our first house. There's a new study from UC Davis showing that vines on walls are very effective for cooling. Solar screens can be put on easily and quickly on existing windows. They're like mosquito window screens. And overhangs, I built one myself on my first house, and then I built a patio cover. Those are fairly inexpensive things to do, on your south side. The west side of the buildings are trickier. There, you want to minimize the size of the windows. You can get some shading that works on those, but other quick solutions during examples, I guess, we've already covered those. Air sealing is something is kind of a DIY thing you can do or have done. It's not very expensive, but I would. There's tons of really good examples on how to design a new or retrofit building to factor in future climate, and that's where we need to be going. And there's a lot of examples from the UK which kind of started this ball rolling, because they were already having overheating problems even in their so-called green buildings, and they were moving towards net zero, low carbon buildings, and this was a problem that was already cropping up. And part of that has to do with having good ventilation, which works great in Britain, but up to a point, even they will need air conditioning in these cooler climates. In the hotter climates, we already need it. The question is, how do you reduce the peak demand? And there, you want to do the passive cooling measures first, which I mentioned earlier, and use an optimized type of approach. There's software that does that. And ideally, you also optimize for GHG emissions and energy use and lighting, because lighting interacts with your solar heat gain, but it's an important health effect or factor. And so there's actually a growing body of research and maybe even demonstration on what they call multi-objective optimization. And I like to call it MOO. And that way you get all these different co-benefits. And in some cases, you actually end up saving more energy than you would otherwise, even though you have also met all these other goals. So that's kind of the quick answer. Canada has a lot of good examples. The Toronto TowerWise project, many passive house projects are now looking at overheating assessments and mitigation, and they're finding that their models aren't predicting it so well because there's more internal heat gains than their models assumed, and people bring in a lot more equipment, or there's overcrowding. So they're having to, in some cases, add shading to the building that they originally designed. There's cheap kind of fabric shades that you can just attach to your eaves, or even like bamboo screens that help. So there's a lot of different ways, to do short-term and longer-term integrated approaches.
Thank you so much, Tom. Just to maybe switch gears a bit, a question for Holly. What is the, ACF doing, in terms of reaching populations who are most adversely impacted by heat stress? For example, older adults, individuals who are disabled, young children, and, communities of color. If you could just, maybe just cite a few examples of, ongoing work or work that's being planned.
But yeah, our program has a priority to serve populations that you actually just mentioned. We have 3 vulnerable populations that grant recipients can actually prioritize: children 0 to 5, older households 6 years or older, and people with disabilities. The other thing that we also are doing is being able to do various radio ads to ensure that people know that Liheap is available. And we're targeting those areas of, making sure that they're in multi-language locations. So we have different versions of those audio news releases, and we are also targeting communities of color. And in FY23, we are actually going to start collecting demographic data so we can be able to do more analysis to kind of see where our resources are going, specifically what households we're serving and who we may not be serving. If you do look at that dashboard on the 3rd tab, you can actually see from a vulnerable household that we do track right now who we are serving. And you can also see that nationally, we are serving the lowest of the low income. More than 50% of our benefits actually go to households who have 75% of poverty or less.
And just a quick follow-up, Holly, one of the questions was, is there any ongoing program around weatherization from cooling that ACF supports?
There's a program component in the low-income home energy assistance where state recipients can set aside a portion of their funds for what's called Liheap weatherization. Many times it follows the same policies and procedures of DOE weatherization. And DOE weatherization is a national program that runs in both heating and cooling states. Therefore, you would apply those same cooling technical strategies to Liheap to the Liheap weatherization portfolio. So those funds do exist, and they're available similar to the weatherization assistance program availability.
Thank you so much, Holly. A specific question for Dave. This came in the chat as well, or at least related to, what is the state of knowledge regarding heat exposure and heat health risk that we face at home? What is that evidence base that you're working on, when you're thinking about strategies that would reduce that risk that individuals face inside their houses?
Thanks, Shubhaya. It's a great question. And it's my impression that in terms of the real behaviors and real conditions of people in the actual world, we're working off of a pretty scarce evidence base. Unless I've missed a corner of the academic literature, I think we could count the number of research papers that have a reasonable sample size with people going about their daily lives, understanding what they're experiencing at home on maybe our hands and feet. And I'd love to hear if I'm wrong on that assessment. We heard earlier from the council member about the penetration of air conditioning into his jurisdiction. And I would love to add to that conversation data about air conditioning use in the community. Here in Phoenix, depending on exactly how we count air conditioning, we might claim that 97, 98, 99% of dwellings have air conditioning, but that absolutely does not mean 99% of people are completely protected. We think a majority of the people who have air conditioning face some constraint in how much they're able to use that each summer, let alone units in disrepair and so on. So I think we have, for any students or young scholars on the line, I think there are many dissertations and great grant proposals to write on this topic to really understand what people are experiencing at home, what the behaviors are to achieve some of the goals that Janice was outlining before, how people are dividing their homes using cardboard boxes and aluminum foil on windows. I think there are a lot of creative behaviors that we can learn from and learn how they impact exposure. But in terms of understanding exactly which homes are going to be too hot this summer, it feels like a big needle in haystack problem. And I'm not even exactly sure what the needles are that we're looking for, or what the hints are that there are needles out there to look for. Not to be too pessimistic, but a lot of opportunity ahead.
Thank you, Dave. Do we have the council members? Is council member Tom still connected? Maybe not.
No, I am. Can you hear me?
Yeah, we can. There was a quick question for you before we let you go. What were the major challenges faced in promoting the heat resilience legislations that you have championed?
Yeah, sorry, my phone got too hot, ironically, momentarily. I was pleasantly surprised that we were able to work it out without a great amount of opposition. I found this in our buildings of owners community in the past, that the folks who have, the vast majority of our landlords are trying to, put a responsible product out on the street, and they don't want their tenants to be encountering, having any health effects due to unsafe housing. It's some of the, smaller individual owners that might be out of town, that might live out of town, that may have inherited a property from their grandparents or something, that don't keep it up very well. But most of the larger chains are pretty responsible. So we didn't really have opposition from them because they were welcome. I think they didn't want to fight the bill, and they were relatively welcome to the idea that they, if we brought things to their attention, they weren't getting a fine for the first violation. They were getting, some sort of warning and ability to a challenge to fix the problem. And then if the problem wasn't fixed, then they'd be subject to a fine. But the goal of just keeping our tenants safer, was I think shared between, us advocates and the landlord community. I did want to say, relative to the previous question, one of the things I learned, and I know this is not a surprise to many of all the panelists, but not being a health expert myself, I was pleased to have the support of our health officer. And, I was familiar with heat stroke and heat exhaustion, and, eventually death, that some of our tenants had encountered. But I learned from our health officer how prolonged living in overheated apartments exacerbates all kinds of existing health conditions, from heart disease to diabetes, COPD, asthma. All those are exacerbated by overheated conditions. And that was, one more, I think, strong argument that led to the bill's passage.
Thank you, Council Member. Just a quick follow-up on that. Was there a part of the legislation that also ensured, or at least was, directed towards, any assistance that needy families might need to keep the ACs on during the summer when they need them the most?
Was there any assistance available?
Or any directives towards that? Any planning towards, any financial assistance that may be available?
Yeah, I think this is a couple years ago now. I think there was a small amount of funding available for some of the landlords to make upgrades if they needed to. We didn't want the cost to be passed on to tenants at all. Generally, the energy bills are paid by the landlords, and if they're not, and they're controlled by the tenants, we left it that tenants wouldn't be fined if they chose to have any hotter apartments. We had a complaint-based system, so it's really up to the tenant to to bring a problem to our attention. there was the climate issue too of, well, isn't it bad for the climate to require air conditioning? That's certainly an argument. I'd argue that keeping people alive and safe in the short term is, we're talking about a small amount of people. It's not, we're not going to solve our climate problems by keeping people in unsafe housing. But another counter argument is just the fact that so many of the older air conditionings that are deficient, defective, are extremely inefficient, and landlords can save a good amount of money by using new energy efficient technology and pass that on to their tenants ideally.
Thank you so much, Council Member. We really appreciate your time. Dave, you wanted to follow up on that?
Yeah, just to share a somewhat similar experience from the Phoenix area. While our legislation is not exactly the same as the council member described, we do have a cooling ordinance that requires any dwelling that has an air conditioning unit to be able to be cooled to 82 and evaporative cooling with 86. And council members suggested that there was some alignment between the housing community and the policy community. Everyone was working toward a shared goal. And what I've learned from our neighborhood services department that enforces our cooling ordinance is the same concept, that with a couple of years of productive conversations with the housing sector, the number of complaints, particularly from repeat offenders, has gone way down. So I am optimistic in this direction that there is a shared goal. We recognize this is a really important public health issue, and I think it'll be interesting to see how different jurisdictions approach rules and incentives in this space.
Thanks, Dave. And a question that came in from the audience, and this anybody should feel free to step in and respond. Is there a commonly accepted indoor temperature threshold for interventions in vulnerable populations? Really practical question, very direct.
I'm ready to take notes. I'm looking forward to hearing the answer from maybe Tom and Holly.
What was that question again? Is it about temperature targets?
Is there a commonly accepted indoor temperature threshold, for interventions in vulnerable populations, beyond which individuals start feeling unsafe and unhealthy?
It's not really a specific consensus like a industry standard or anything, but I've been compiling standards from all over the world, and they center around 26 degrees C, which is what, 80 some degrees Fahrenheit, up to 31, depending on the population and whether it's a bedroom or not, and so on. And I think there's a fair amount of experiential type data to support that. My response, I think, to that question was, and I've grappled with this for a decade, is what is the right metric? In fact, we did a paper on that in 2015, and there's all kinds of different metrics of how do you measure it, and then what are the target levels? And I finally got to the point recently where we just need to pick a target and go for it, because we need to move forward. We can't wait for another 5 or 10 years of research. We know which direction we need to head. And I think we'll solve a lot of problems by just addressing even a moderate temperature or even extreme temperature increases. But in any case, the approach is the same. The target is kind of secondary in a way. So I guess I would say, in fact, I've just proposed some building standards for California, and I don't know if they'll get through the sausage grinder for building standards, but I've proposed something like cutoffs, 26C, 28, 31, and so on. And anyway, so yeah, I think there's kind of a central general range of temperatures that people are using, and that we can certainly always use more research. The one other point I would make, and this kind of hit home recently, even though the research is older, is that like outdoor heat exposure, the indoor exposure seems to have a nonlinear effect. That is, if you're just counting hours over a certain temperature, you could be misled by the actual benefits and health effects if you don't consider the much more extreme effects at the higher temperatures. So you almost need to do some weighting or focus more on those real extreme temperatures. Thanks.
Thank you, Tom. Janice, any reflections on this, if you would like to?
I was just going to type. I think that the one thing to also stay aware of is if an individual has a chronic health condition, a respiratory condition, those thresholds might be a bit high. And depending on the level of acclimatization of a particular culture, I know in the Netherlands, there was a study recently at that same low temperature threshold that we were just talking about. They had a 12.5% increase in emergency room visits from seniors. So there is a connection between what you're used to and what those thresholds might be. We just need to think about that in concert with the health conditions that individuals might carry.
Thank you, Janice. We might have time, to squeeze in one more question. This was specific to Holly. If a state to date has not provided funding for cooling through Liheap, what challenges exist to adding cooling to that assistance portfolio?
Well, Liheap is a block grant, so the Liheap program has a plan. They submit it to us. During that plan phase, which is during the summer months, you can actually engage with the Liheap program administrator in your state to see what their plan is for this upcoming year to consider cooling. But we also have a category called year-round assistance, which allows the ability to be responsive in those cold climate states that may not have specific cooling programs. If they do year-round crisis, they're able to help families during those extreme events. And a lot of state general assemblies are actually starting to put in moratoria at a certain threshold. If the temperatures are over a certain degree, that households cannot be shut off. So there are some things that are kind of in process. So I would recommend, if you're not engaged in the Liheap planning process and want to, please reach out to your administrators and have the ability to comment on what they're doing with the Liheap resource. That is one avenue to be able to ensure cooling is actually part of that portfolio.
Thank you so much, Holly. And, unfortunately, we are inching towards the end of the session. And so I really wanted to thank the panelists for sharing your time and your expertise and your perspectives. And, thanks to the organizers for, again, organizing this wonderful meeting. And I would pass it back to Hunter. Thank you, everyone, for joining us.
I will echo Shubayu's thanks to all of the panelists. What a great panoply of perspectives from federal and local government and from NGOs. I learned a lot in this session, and I felt it was very practical. And we're going to continue that trend. Up next, we will turn to an exploration of urban heat islands, and in particular, some practical tools and resources that can be used to explore options for reducing them. This session will be moderated by Victoria Ludwig, the National Program Manager of EPA's Heat Island Reduction Program, where she provides technical and outreach support to local governments and other stakeholders on mitigating heat islands and implementing local solutions for sustainability. Victoria has worked for the EPA for 15 years and has over 25 years of experience in the environmental field, working in the private, public, and nonprofit sectors. Her areas of focus have included landfill gas energy, sustainable materials management, and climate change mitigation in Latin America. She has degrees in biology and environmental management. And at this point, I will turn it to you, Victoria.
You're on mute, Victoria.
Oh, thank you so much. Okay, hello, everyone. It's a pleasure to be here, and thank you, Hunter, for that nice introduction. We have 40 minutes for this jam-packed session, so I'm not going to go into detail about what the heat island is. We've heard a lot about it over the course of the 2 days, but if you are new today, feel free to join the breakouts at 2:15 or just reach out to me or any of the speakers, because I think all of us can really geek out on heat islands. But I'll just say that at EPA, we've been working on the issue for over 20 years, helping local governments increase their capacity for understanding the heat island and what they can do at the policy level to mitigate it, to cool down the cities, and therefore help get at the heart of what this conference is about, protecting people's health, and especially those that are most at risk for heat hazards. The format today is not so much PowerPoints. It's designed to be a lightning round, quick training on some select tools that you can use to understand sort of the base foundational information that you need to understand the risks of the heat island in your community, get that baseline data. You need that in order to take the next step, which some of these tools also address, which is to understand the decisions you can make to reduce those heat risks as far as adapting to heat, where to place cooling centers, for example, and mitigation, where to plant trees and where to put cool roofs. You really need to do both of these in order to have effective solutions to reducing the heat island effect. First off, I'm going to kick it off with some federal tools that are helpful for this first part that I mentioned, which is understanding the extent of the heat risks in your community, both geographically as well as demographically. So that means knowing where the hotspots are, exactly how hot they are, and also understanding where people live in your community who are at risk, the highest risk, whether it's older people, minorities, people with lack of air conditioning. You really need to look at both geography and the demographics to start the process, as I was saying. And again, with this whole panel, these are just a few of the federal tools that are out there. And so please reach out to me or Hunter. We can tell you about and give you, there's information on the NIHHIS website about tools, I know. And so these are just a few. But we obviously wanted to brag about the tools from our own, from the federal government. So on the first slide, you will see, great, thank you. This is the Heat Vulnerability Mapper and UHI data sets developed by NIHHIS, which with NOAA playing a lead role. The tool produces important data for understanding where and how strong the heat hazards are at a hyper-local level. And it does this, as you can see, by getting down to looking at the temperatures at night. And this was done with volunteers who put air sensors on their cars, went around the cities and measured both the air temperature and humidity, as you can see, which you really need to look at both of those in order to understand the extent of the health risk from heat. And so it's really, it's evidentiary information that is really helpful. And then the public engagement part was great for raising awareness. And I believe there are almost 50 of these maps now, which are all on the NIHHIS website. So your city very well might be in there. So please do engage with that. The next slide begins talking about the people side of the equation. And both this tool and the next tool they answer the questions, okay, so if you have those hotspots, maybe from the NIHHIS map, do those overlap with areas, again, that have a high percentage of folks with low incomes or folks who are older or children, because you need to get at that level, as I was saying, in order to make informed decisions. EJ Screen 2.0 is an EPA tool. We just released the second version of it. And the tool is really great for, it's a GIS tool. It looks at promoting a nationally consistent screening and mapping tool for environmental justice. So it has these 12 EJ indices, and index is a combination of not just demographics, but environmental data to show where the vulnerable populations live that are disproportionately impacted by pollution. And that's air pollution, water pollution, and land pollution. So for example, it shows where Superfund sites are. It shows where areas are that have high levels of ozone. And we know that if there's higher ozone in a neighborhood, that increases people's risk for heat because it just makes their immune systems weaker to combat heat, as well as air issues. The new tool has some new health, climate, and critical service layers that you can put onto those indices. One critical service, for example, I believe is where hospitals are. And it's really high resolution. It gets down to the census tract. So I would highly encourage you to check that out. There's a link there. We have recordings of trainings and live trainings. So please do check that out. The next tool was very recently developed by the Council on Environmental Quality. And that is in a beta version. It's not finalized yet, but it is designed to provide a uniform whole of government definition of disadvantaged communities to help federal agencies target their programs and their investments that are under the Justice 40 initiative. That initiative, I think we heard a little bit about that, is to ensure that federal programs are 40% of the investment benefits are reaching the most vulnerable folks as far as economic and climate risks. So this tool is designed to help come up with consistency to do that. The current version includes socioeconomic, environmental, and climate information to inform decisions. One quick example of climate is that it will show you projections of estimated agriculture loss in an area that is related to potential climate risks. So that's just one example. And the tool's designed to inform agencies for guiding the benefits of not all the programs that the federal government has, but just certain ones like clean transit, workforce development, things that I was saying get at sort of those climate and economic risks. And again, there's a URL, and I just want to say that the two tools can be confusing, but they are different. EJ Screen and the CEJST, they really are designed to complement each other. So EJ Screen provides a tool that you can use to screen for potential disproportionality at the community level, while the CEJST, that one needs like a pithy word. That one defines and maps disadvantages communities for the purpose of informing federal agencies, like I was saying. So anyone can use the tool, but it's going to be designed around consistent definitions and numbers that all of us can use at the federal level. Okay, let's move on. I want to give our speakers as much time as possible because the previous three tools, as I was saying, help you lay the groundwork for understanding where the hotspots are, and as far as your heat island effect, you know, the heat island, that microclimate, and then where do folks live that are really vulnerable to heat? Of course, we know everyone's vulnerable to heat, but more folks are dying from it than others. So let's try to target our interventions there. So what interventions do you do? The next two tools are really great for helping you do that, sort of taking the next step of where and how to implement, where, what, and how, and why to implement interventions that reduce heat and then help those most at risk. Now, again, these are only two tools. There are several out there. So please reach out, join the breakouts to learn more, because we can let you know what others are. But we thought these are really good tools because they do a good job of integrating sort of both sides of the equation that I was talking about. The components related to risk analysis, as well as, you know, baselines of data. And then they add on the screening of various mitigation strategies at a very local level that you can use, that decision makers can use, state, local, whatever, to help with planning decisions around these interventions to reduce the heat island effect. So each speaker is going to speak for 10 minutes, and then at the end of each speaker, we'll do 5 minutes of Q&A for that particular tool. So don't fret, because we have breakouts where you can talk to those folks about their tools for 15 more minutes in depth. So we're just trying to do a quick fire hose approach. Okay, let me start with the C40 Heat Resilient Cities tool, which is really great. And Snigdha will tell you more about C40, but the person who's going to present this is Snigdha Garg. She is the head of adaptation research and performance at C40 Cities. She has over a decade of experience working with cities on climate resilient strategies and solutions. Specifically, she's worked with over 300 cities globally on urban resilience, public policy, climate change adaptation, and resilient infrastructure. Snigdha is passionate about impact-driven action and strives to achieve it through meaningful collaborations. And I know at EPA, we love collaborating with C40, and we hope to continue to do more. So please tell us, Snigdha, about your great tool.
Thanks so much, Victoria. And hi, everyone. Thank you so much for inviting us to present the tool. Before I get into the tool, just a tad bit about C40. C40 is an association of global megacities. We work towards reducing emissions to keep them under 1.5 degrees and deliver resilient and equitable solutions for all in cities. And heat is, of course, a very key topic that our cities face and have challenges with. With that, let's get into the Heat Resilient Cities tool. Next slide, please. So what is the Heat Resilient Cities tool, and what does it really do? Think that you're a city planner and your budget decisions are being made, strategies being decided. And this is where those critical decisions of where to invest the money, which actions to choose, is being decided. That's exactly where the tools come into play. That's exactly where this tool comes into play. You could use it at a climate action planning stage or during the implementation stage. And what does the tool really help you do? It helps you prioritize your heat resilience actions in the city. It enables the city to really identify which are the most impactful actions, whether that's cool roof, whether that's parks, or both in what capacity will benefit the city, and then really make the case for these actions, because obviously there are limited resources in all cities. So just to ensure you're making the right case to invest in the right solution. Next slide, please. And how does the tool do this? Well, the tool does this by quantifying the health benefits of heat resilient strategies. So looking at what kind of health benefits and impacts will cities have if they invest in heat resilient strategies. And the strategies that we look at, or actions or solutions, whatever you want to call them, there are 4 common heat actions we look at. One is urban parks, urban water, cool artificial roofs or white roofs, and then cool vegetative roofs or green roofs. These are, how did we choose these 4 actions? Firstly, we came to these 4 actions primarily through our city consultations, what are the key actions they were taking, and also going through all the adaptation or resilience plans that cities have and identifying the top solutions. Now, how does the tool really assess the health benefits? Well, it's a 2-pronged approach. First, it assesses what is the temperature reduction benefit of these 4 actions. How does it reduce temperature? And then from temperature reduction, how do the health benefits come into play? Next slide, please. So here is a snapshot of what kind of benefits does the tool look at. So as I said, it assesses what is the reduced temperature, then moving on to health. What is the reduced mortality through these actions? What can be the reduced morbidity? And through that, what is the reduced health cost and value of lives saved? So it covers 3 aspects, the environmental, societal, and economical aspects to make the case for these actions and have quantified benefits. Next slide. And here's an example of a city using the tool. So these are the results from Medine's green corridor, Medine from Colombia. And the action they chose was green corridors, here shown as parks. Let's look at the second, the green, brighter green arm of it, which looks at RCP 8.5 and shows the number of days reduced due to from the heat threshold due to the green corridors. What's the decreased urban heat temperature? What are the deaths averted? Here it shows 116. This is a period between 2021 to 2030, so about 10 years. And if you increase the coverage of green corridors, covering 30% of Medellin, you save $96 million in those 10 years in the city. So that's kind of an example of what kind of benefits you can look at. You can, of course, get into details of morbidity and mortality, which is not depicted here. I'll show you in a second in the tool. With that, next slide, please. We'll get into the tool demo and I'll give you a very quick flavor of what the tool looks like. But as Victoria said, happy to answer any questions in the Q&A, but also in the discussion later. Sorry, give me 1 second to share the tool. There we go. Can you see that? Victoria, give me a shout if it's not visible.
Looks good.
Awesome, thank you. So the tool is an Excel-based tool. You can navigate it through the tabs here or at the bottom. And what it really does is walk you through the first page, really just introduces the tool, walks you through what it does. I'll skip that. The second tab gets you through the workflow of the tool, how it operates, what it looks at. And then the third part is, which is the pathways, that's where we start getting into the actions. So while in the tool, we're looking at the health benefits of these actions, of course, there are tons of other benefits, right? And we didn't want to skip on those. So what we did do is develop a pathway map for each of these. You will see that cool and vegetative roofs are combined. There's obviously a methodology behind it, which I can get into and geek out on if you're interested. But these pathway maps really walk you through what's the action, what are the outputs, what are the outcomes, and then finally, what kind of impact can we look at other than health as well, including health, as you see here. Okay, let's get into the tool. So this is where the actions are. Let's pick urban parks. And this is the user input tab. This is where, as a city, you would enter all your information. You'll see two colored tabs, like gray and blue. The gray is pre-entered information for your city. If you don't have specific information, there is information we've chosen through global data sets. Blue is where you can enter your own information if you choose to do that. The more you enter city-specific information rather using local data sets, needless to say, you'll get better results. But before I start demonstrating exactly what this does, is one of the things why we developed this tool is we got a lot of questions from cities that there are studies out there which talk about this is how trees will benefit my cities, or this is how trees will benefit urban areas. But doesn't mean the benefit that New York will see, Barcelona will see as well, or Accra will see as well. So how do I get my city-specific benefits? Well, that's a tough question to answer, but that's exactly what we've attempted here. So one of the things that we've based the tool on, apart from other things, is ensuring that climate zone is at the center of it to have city-specific data. So as you can see, you choose, I'll go with what I've chosen already, Barcelona. We're looking at impacts between 2020 to 2050. Then you get into the action details. So since our action was urban parks, this is the size of park we're looking at. There's a pre-entered data on what would be the canopy cover. You could change that. Now, of course, expecting huge results from one park is quite a lot, right? So how do we make a case for a stronger nature-based solutions or green infrastructure strategy? So what if 30% of the city was covered by park? What kind of benefits would you see then? You will still see benefits from one park, but they are just not as much to demonstrate in terms of life saved. So, but you do get results for both. And then you get into specific data on what are the environmental inputs, what scenarios you want to look at, what are the social demographic inputs. For example, what's your population structure? This will determine if vulnerable population gets impacted. What is the disease information or hospital admissions in your city? And then you get into some of the economic inputs. And again, you'll see pre-entered information here. I'll move on to impact. So impact tab is where you get more detailed answers for a lot of things. You get into mortality and morbidity details, but I'll go to the results page, which shows what was on the slide earlier as well. So here in the case of Barcelona, I had chosen RCP 4.5 and 8.5, and you can see the reduced heat due to parks is extremely high, which is very different from what was in Medellin. Also, Medellin was looking at 10 years. Here we're looking at almost 30 years. And then the kind of health benefits you can see, let's stick with 8.5 scenario. 2 deaths averted if it's just one park, but it changes quite significantly, around 8,000 when we look at 30% coverage. And similarly, about $8,200 million saved in economic benefits. And these economic benefits are only through health. Of course, there would be other economic benefits as well. So that's a little bit about the tool. I'll stop sharing. Very happy to answer any questions.
Awesome. Thanks, Snigdha. I used to work for local government, and I know that this kind of tool is really helpful since we don't have a lot of staff to do things, and it's just really great. And also Barcelona is on my bucket list. So now when I go, I'm going to be looking at it in a different way. So we did have some questions come in. I think we have a few minutes. The first one is, what is the definition of urban parks in your tool? Is it based on size, geographic distribution, acres per capita, etc.?
Excellent question. A question we struggled with a lot when we were defining the boundaries of the tool. So yes, on size, but also canopy coverage. Because if there is a huge green field that has only so much of canopy coverage, so we set a minimum threshold of there should be X amount of canopy coverage, which in this tool I had chosen to be 80%, without which we won't consider a park. So size and canopy coverage.
Great, thank you. And why, the next question, why are street trees not included as a tool alongside urban parks? Or is urban parks, I think you just answered this, but a proxy for percentage of canopy?
Pretty much, yes.
Yeah. Okay.
Yeah.
And you also answered the next one. Is there a minimum size for the park? You said it's not acreage, it's percentage of canopy.
Absolutely. And
okay.
Because of street trees as well. Yeah.
Okay. Next question is wind or sea breeze, things in coastal zones, are those included?
Sea breeze, no. What we have included is humidity. And again, these are things you have to, it's so interesting and fascinating when you develop these tools, what you include and what you don't. When you start including sea breeze, my ideal would be if we could include flooding in this as well and combine hazards and look at the joint impact on heat. But for now, no.
Yeah, it's hard to include everything, isn't it? And the next question is something I have gotten in the Heat Island program. Urban parks are increasingly being covered with plastic or synthetic turf carpeting, especially here in the US, right? And tire rubber playgrounds that might be actually hotter than asphalt. In your park mapping, do you take anything like that into account?
We have not, but that's a really interesting point. And as increasingly that happens, I think that's really relevant to do. We're actually in the works of developing a second version of the tool. And I'll ensure we take that into account where we want to include mental health, labor productivity, and considerations like that in addition or inclusive in health.
Oh, that sounds like a nice project for the NIHHIS federal partners to get into. And I can just add that I think parks are an easier place to put cool pavements than a road. And local governments have tried that because you don't need to worry about durability for cars. So maybe a solution, if local governments really do want some kind of hard, softish surface, not grass, they can use a cool pavement. So that's a good one. Okay, well, we have to wrap up. Thank you, Snigdha, so much. That was fascinating. Again, at 2:15 during the break, you can join her and really geek out on this tool. And so thank you so much. I appreciate it.
Thank you, Victoria.
Let's move on to a really fun tool that was developed by American Forests. They're going to have two people speak, Chris David and Joel Pannell. I'll just quickly introduce them. Chris leads the GIS and data science team at American Forests. He spearheaded the development of this groundbreaking, and it really is groundbreaking, tree equity score platform and its associated applications and products to support equitable access to trees in cities across the country. He and his team help staff across the organization use the data to tell compelling forest stories and develop science-based decision support applications that lead to better outcomes for climate, water, wildlife, and health. So that's just another emphasis on the multiple benefits that trees bring. Joel Pannell oversees the efforts at American Forests to build and promote their positions on a range of urban forest policy and related social equity issues. He works to build and maintain relationships with a variety of partner organizations and key stakeholders to advance policies that are centered at this intersection of urban forestry and social equity. And Joel played a leading role in the creation and growth of the only federal grant program addressing park equity in cities, as well as the launch of the 10-minute walk campaign, which is that everyone should only have to walk 10 minutes to get to a park. And he has also worked for the Sierra Club and the Trust for Public Land. I believe Chris is going to go first. I'm not sure. I'll just let you guys take it away.
Thanks, Victoria. I'm actually going to go first, and I will be brief. So thank you for that introduction. And we are thrilled to be here today to talk to you about trees and tree equity, which everyone here knows are our best natural air conditioner and air filter to combat the deadly impacts of extreme heat. Next slide, please. So American Forests, what is tree equity? We know that unfortunately, a map of tree cover in almost every American city is also a map of race. It's a map of income. It's a map of race often in ways that transcend income. And so American Forests really envisions a world where everyone can enjoy the full benefits of trees, regardless of socioeconomic status, regardless of zip code. Everyone should be able to enjoy those life-protecting benefits that trees provide. And so that's sort of what tree equity is centered in, and our work to advance tree equity is centered in. Next slide, please. And so, again, American Forests is, some of you may not know, we're considered the oldest conservation organization in the United States, founded in 1875, helped actually found the U.S. Forest Service. And so we've been at the forefront of the forestry movement in this country since the beginning. And now, just really excited that we're able to also join the front lines of those fighting for climate justice, as we know that impacts our most vulnerable communities. Next slide, please. And so these are some of the goals that we are working towards by the end of this decade. And so we would love to see 100 cities taking action to move towards ensuring every neighborhood within that city has a passing tree equity score. We are doing a lot on the career pathways front and trying to create jobs in the very communities that are hit first and worst by climate change, extreme heat, and other climate impacts. And so the way that we go about doing that is we sort of have an impact model where we do movement building, that's coalitions, campaigns, our career pathways curriculum, and then the public policy work that I I lead, where we're just so excited. There's so much momentum on the Hill. Today, Senator Sherrod Brown from Ohio will be introducing the Neighborhood Trees Act, which directs about $2 billion to urban and community forestry over the next 5 years as proposed. We know the Healthy Streets program that's in the that was authorized in the Bipartisan Infrastructure Act. I know that Senator Markey spoke to this group, or his bill, his EJ mapping bill was talked about earlier this week. And so we're just really working to continue to build that momentum and build those champions at the federal level and all levels of government and decision-making for the value that trees bring to cities. We're also doing a lot of place-based work where we're working in cities across the country and then also working in large forest landscapes. And then lastly, our innovation work, which Chris can tell you about much better than I can, but research reports, technical guides, and tools like our tree equity score that Chris is going to demonstrate now. So thank you for your time. And again, really look forward to engaging with everyone on this issue. Chris?
Thanks, Joel, and thanks, NIHHIS, for including us, and thanks, Victoria, for the introduction. Can we go to the next slide, please? So I'm gonna spend a little time talking about our Tree Equity Score platform, a freely available resource. You can go to it right now at treeequityscore.org to help make the case for more equitable tree canopy cover in cities across the country. Next slide. So trees are on the front lines, providing both offense and defense, as our CEO, Jed Bailey, likes to say, in the face of climate change. Reducing temperatures and sequestering carbon, filtering multiple air pollutants, even reducing energy costs. You all know that. Increasing tree cover will mitigate the exacerbating impacts on existing conditions like asthma or heart disease as well. And we try to incorporate that into our tool. Next slide. And more, our research, and there's more and more research coming out indicating the truly measurable benefits, mental health benefits of trees and nature. And we take advantage of some of that research in Tree Equity Score as well. Next slide. So these maps, as you look left to right, are a really good way to sort of highlight what tree inequity is. So often less treated places are in low-income communities, communities of color, communities that have been historically ignored or lacked investment. For some context on the scale of that challenge that we have as a country, our analysis across the entirety, every urban area in the continental United States shows that there are 66% more trees on average in the wealthiest areas than the poorest areas of cities, and 33% more in whiter areas of cities. That discrepancy, as you all know, can have dire impacts. Climate change exacerbated by the urban heat island means greater impacts from those existing conditions I mentioned, and that's wrong. Everyone deserves the access to life-sustaining benefits of trees. Next slide. And that's why we created Tree Equity Score. It's a tool to support the work that many folks are already doing. Many of you here are already doing. We like to think it's creating a national standard, a baseline for understanding and engaging with communities around trees to inspire and educate, advocate for investment, implement new policy, et cetera. We're really proud and excited about that tool. And we're going to go to the next slide, and I'm going to talk about math for a second. Actually, let's go 2 slides in advance because I know we have limited time. I just want to summarize it all together there. This one's perfect. So it's a very relatively simple formula. Your tree equity score is a measure of tree canopy need, which we calculate by setting a goal based on where you are in the country, a forested grassland or desert area, and the density of the population that of the neighborhood that you live in. And we subtract from that the existing tree canopy cover in that area. We use a variety of data sources to do that, but that's our measure of tree canopy need. And then we combine that and multiply that by a priority index, which you might see, it's not entirely the same, but EJ Screen was very much an inspiration for the work that we did here, as well as we were very excited about 18 months ago when CDC Places came out with more broader health data. So we combine a variety of demographic, health, and yes, the urban heat island surface temperature data to create a priority index. And that combination of need and priority is what you get, is how you get your tree equity score. Next slide. So that's the score. It's normalized between 0 and 100 on a municipal to municipal basis. We have it for over 150,000 urban neighborhoods across the country, and we're expanding. The lower your score, the greater the priority for tree planting. Every neighborhood's goal should be to get to a score of 100, meaning that it's met, that neighborhood has met its tree planting goals individually. Next slide. Actually, let's just go forward. I'll cover this slide during my demo since we only have, 2 minutes left. So I will share my screen very quickly. Let's see if I can get the right one. Perfect. So this is the platform. You can follow along on your own if you want. It's treeequityscore.org. I'm just going to take us in very quickly so we have a couple seconds for questions. So I just zoomed us to Philadelphia. I'm moving very quickly. I apologize for that. But I just typed in and IntelliSets filled out Philadelphia for us. It took us directly into our application, right into the map. And you see a map of Philadelphia where we have, for every neighborhood in the city, calculated a tree equity score. As you drag your mouse across each neighborhood, you see the score. You can look at the data in different ways. You can look at average surface temperature across the city to sort of get an estimate of what the urban heat island is. And that's all normalized on a city by city basis. You can look at people in poverty, where seniors are, where children are, what the tree canopy percentage is, and it'll show you as you mouse over that neighborhood. I'm just going to go back to tree equity score for now. You can filter that data. So you can look at, only those neighborhoods that fall in the 75th percentile or greater in terms of temperature. So the highest surface temperature areas across the city. You can also identify the areas that have the highest number of people of color in the city. So it can help you hone in on the neighborhoods that you're interested in focusing on in that region. I'm just gonna go back to the full map now and just take you into our reporting, the reporting that we have for each one. So I'm just gonna click on one of the neighborhoods in Philadelphia. This is a neighborhood that has a score of 60. It ranks of the 1,300 neighborhoods in the city, over 1,300 neighborhoods in the city, near the bottom. So it's one of the lowest scoring neighborhoods. You can see the breakdown of our priority indicators here, where it's the more pink you see in this, what we call a radar chart, the higher the priority is, or the higher the overall priority is. You can see how much tree canopy cover is in that neighborhood, what the goal that was set was. And so you see that there's a lot of work to do here. We would expect or hope that we could get potentially up to 33% more canopy in that neighborhood. That's a lot. We also have different ways to actually summarize and review information at the city scale. You could look at it at your congressional district as well, or at the state scale as well. I'm going to focus on the city. So I just clicked on the report for the city. And what you see is just a summary of what's going on in that city, the distribution of tree equity scores, the overall demographics in the city, and some charts. This chart very much mirrors is the same as what the trends that we see nationally. And what you're looking at is the x-axis with people of color and tree canopy on the y-axis, the difference from the mean. And what you see is the less people of color in a neighborhood in Philadelphia, the more tree canopy cover. And the more people of color, the less tree canopy cover. You can look at it the same way for people in poverty, and a not very surprising comparison with temperature as well. You can also sort of set goals and see what the benefits would be of increasing tree canopy cover. We use iTree to estimate these benefits using the iTree landscape tool, but you can identify and set goals for tree canopy cover for tree equity score. So if you want to get every neighbor to at least a score of 75, you would have to plant 97,000 trees. And we summarize what the benefits you would get from that tree planting process. And we also have done some original research or commissioned some original research on what the economic benefit would be in terms of jobs. These aren't all full-time jobs. So we're not saying that you're going to create 711 new jobs, new full-time permanent jobs, but these could be seasonal jobs. These could be part-time jobs, but it is an economic driver. And it's important not to forget that when we're talking about tree planting in cities. So I will pause and stop there. I'm sorry I moved so fast, and I'm sorry that I went a little bit over time.
It's okay. It's okay, Chris. Thank you so much. I really wish we had more time, but we did get some questions, but I'm gonna, not to pick on you, not to make you feel bad, but I'm gonna use them as a teaser to have people join your room. So, because remember, and I'm going to turn it over to Hunter to explain logistics, but there is a chance for people to get one-on-one with you and Joel and ask questions. So, but thank you so much. It's a fabulous tool. I am dying to play with it a little more. Thanks again. We're going to go into breaks and other things. I'm going to let Hunter explain the logistics of exactly what's happening. It's moving pieces.
Thanks, Victoria. Thank you for moderating. So at this point, I don't know about you, but I could use a quick break. So that's what we're going to do. We're going to take a quick break until 2:30 Eastern time. And while we do that, we'll have breakout rooms open if you'd like to have follow-up questions with C40, with SNGDA, or with the American Forest team. And we also will have a Mentimeter question up on the screen for you to fill out, as we have in the past couple of days. And so take your time, take a break, fill out the Mentimeter, ask some questions in one of the breakouts, and we'll see you all back here at 2:30 Eastern. And just to narrate what's happening here on the screen, you just need to go to menti.com to fill out this poll. And the code you want to use is 12152118. And people are already getting it in there. So thank you. Just a reminder, we'll get started in a little under a minute here. I think the breakout rooms are slowly closing here. Okay. Welcome back, everybody. I hope you're refreshed or you had some interesting side conversations in the breakout rooms. We now turn to our next session to learn about how we can keep workers safe from heat. And to moderate, I'm pleased to hand the mic over to Dr. Augusta Williams, health scientist and 2020 Presidential Management Fellow in OSHA's Directorate of Standards and Guidance. Dr. Williams serves as the technical lead on the agency's heat rulemaking efforts and is involved in several climate change initiatives across the agency and Department of Labor. Prior to joining the agency, she completed her Doctor of Science and a postdoctoral fellowship with the Harvard T.H. Chan School of Public Health, where her research focused on the public health and societal impacts of hazardous heat. Dr. Williams received her Master's of Public Health with a certificate in climate change and health from Columbia University's Mailman School of Public Health and is a graduate of the Hobart and William Smith Colleges. Augusta, over to you.
Thanks so much, Hunter. And hello, everyone. Thank you for joining us on the third day of what has been a really wonderful NIHHIS National meeting. During this next section, we're going to be discussing the occupational health and safety risks that result from heat and how to keep workers safe from hazardous heat exposure while they're on the job. As has been mentioned throughout other sessions during this meeting, workers across many industries face exposure to hazardous heat in both indoor and outdoor work settings. As Assistant Secretary Parker noted in his opening remarks, today is also Workers' Memorial Day, which I think makes this next panel even more important as we think about how to build equitable human resilience to heat, which includes how to best protect the health and safety of all workers. We have a great panel lined up to bring different areas of expertise and different perspectives to this conversation. Today, we'll be hearing from Andrew Levenson from the Occupational Safety and Health Administration, Margaret Morrissey from the Corey Stringer Institute, and Dr. Maricel Pagan-Santana from the Migrant Clinicians Network. I will briefly introduce each of them before their respective sessions, but first I'd like to introduce our first speaker in this session, Dr. Brenda Jacklitch. Dr. Jacklitch is a research health scientist and serves as the coordinator for the NIHHIS Small Business Assistance Program at the National Institute for Occupational Safety and Health, or NIHHIS. Dr. Jacklitch is a heat stress subject matter expert and was the lead project officer for the NIHHIS criteria for a recommended standard on occupational exposure to heat and hot environments. She's going to be providing some overview information today of the health and safety risks of heat to workers and discussing more about that criteria document. So Dr. Jacklitch, I'll now turn it over to you.
All right, thank you, Augusta. So good afternoon, everyone. Today I'll be speaking about occupational heat stress and providing not only some background information for why and how heat stress affects workers, but also sharing some NIHHIS heat-related recommendations and activities. For those of you who may be unfamiliar with NIHHIS, it is a federal research institute focused on occupational safety and health, and it is within the CDC, and we have offices and labs across the country. Next slide. So to start us off, I'm going to give a little background on occupational heat stress, beginning with who is at risk. There are many types of industries that may have workers in hot environments, both indoors and outdoors. A few of the industry sectors that are often experiencing the most heat-related illnesses and injuries include construction, services, manufacturing, and agriculture. However, anyone working in a hot environment may be at risk. Next slide. Adding to the risks with working in these hot environments, some workers may also be facing additional overlapping vulnerabilities. While both indoor and outdoor workers can be exposed to heat and hot work environments, the seasonal variability of extreme temperatures puts millions of outdoor workers at increased risk. And controlling for these outdoor exposures is often challenging and not always feasible due to the nature of the tasks within the work environment. Also, these workers often have other vulnerabilities, such as working for a small business or being an immigrant worker. Some workers may experience language barriers and may lack knowledge and training about workplace hazards. Or there may be cultural differences where something like taking breaks may be viewed as a weakness. Additionally, small businesses, as compared to larger businesses, often face a lack of resources for safety and health practices and greater time demands on managers. As occupational safety and health may not always take priority, small businesses are often burdened with higher injury and fatality rates. Next slide. So now that we have identified who is at risk, how do we define occupational heat stress? The occupational definition for heat stress is the net heat load to which a worker is exposed from the combination of metabolic heat, environmental heat, and clothing and personal protective equipment. This last piece about clothing and PPE is very important in the occupational setting, as many of these workers need to be protected from other workplace hazards and PPE is necessary. However, PPE and clothing can often alter the rate and amount of heat exchange between the skin and the air. Next slide. In addition to PPE and clothing, there are also a lot of risk factors that can place a worker at additional risk of experiencing a heat-related illness. Some of these factors may be environmental, like direct sunlight and radiant heat sources, and others may be related to the individual, like their level of acclimatization and the type of physical condition their body is in. Next slide. With occupational heat stress, there is a concern for a variety of heat-related illnesses and injuries. Heat-related illnesses can vary in severity and symptoms or outcomes, with the most severe being heat stroke. But along with heat-related illnesses, heat can also cause injuries, such as incidents from sweaty palms or slipping on sweat puddles on the floor, experiencing visual impairment from fogged up safety glasses, and touching hot equipment that might result in burns. Other traumatic injuries might occur from a worker experiencing dizziness or diminished cognitive function, which could result in incidents like falls from elevations or mishandling equipment. Also, when extremely hot, workers are also more likely to loosen or remove PPE that may lead to additional danger or chemical exposures. Next slide. NIHHIS has a long history of working on occupational heat stress, dating back to the original criteria for a recommended standard on hot environments published in 1972. NIHHIS has published 2 updates since then, with the most recent in 2016. This criteria document is important because it fills the need for authoritative guidance on heat stress in occupational settings. While a few states have occupational heat regulations, there is, for the moment at least, no federal standard on heat. Criteria documents go through an extensive review and clearance process, and they provide an in-depth lit review and recommendations for measuring and controlling occupational exposures. Next slide. Here you see the chapters and content found inside the heat criteria document. The larger box on the left represents chapter 1, our recommendations for an occupational standard. And this is where you'll find NIHHIS recommendations laid out for workplaces. Other chapters provide additional details and evidence for our NIHHIS recommendations. Next slide. As part of the NIHHIS recommendations, the criteria document provides WBGT-based occupational workers. These limits account for the environmental and keys. Next slide. Traditionally, a hierarchy of controls has been used as a means of determining how to implement feasible and effective control solutions in workplaces. Elimination and substitution are more feasible for chemical exposures, but with heat stress, we tend to focus on engineering, administrative controls, and PPE. Next slide. Engineering controls are often more utilized in indoor environments where heat protective shielding can be placed or cooling fans and good ventilation can be designed. For many outdoor work environments, a shaded structure can be erected for break areas. Next slide. Administrative controls are often the easiest to implement and most cost-effective when it comes to controlling heat stress in outdoor environments. As you can see, there are many different administrative controls, starting with these examples that recommend the use of a buddy system, monitoring the weather, and having a heat alert plan. Next slide. NIHHIS recommendations for administrative controls also place a lot of emphasis on training workers and supervisors, and also having an acclimatization plan. Workplace heat stroke deaths often occur among new workers during the first 3 days on the job, so taking time to acclimatize is very important. Although this is an element all too often left out of workplace heat programs. Next slide. Other administrative controls include appropriate hydration and rest breaks. Employers are responsible for providing appropriate means for workers to stay hydrated and rested, but they also need to ensure that those workers are taking these breaks regularly and as needed. Next slide. NIHHIS continues to be active in heat-related research activities. NIHHIS researchers continue to study the physiology around heat exposures when different PPE ensembles are worn. The NIHHIS mining teams have also researched heat stress in mining populations and developed targeted educational products. Other NIHHIS researchers are working to improve and update the Osha NIHHIS Heat Safety Tool app and develop an online heat stress training tool for employers. And as farm workers are a high-risk population, the NIHHIS Ag Centers have recently developed a logic model for heat-related illness prevention. NIHHIS researchers also have interest in collaborating to expand current health-related surveillance activities to capture more occupational-related data. Next slide. And finally, I want to mention that NIHHIS has many heat stress resources available on our website. In addition to the criteria document, we have other products that are suitable for safety and health professionals, employers, and workers. Next slide. So thank you so much for listening. And if you're in need of additional resources on occupational heat stress, please search NIHHIS and heat and visit our website. Thank you.
Thank you so much for setting the stage with that information, Brenda. Next, we're going to hear from Andrew Levenson, who is the Acting Director of the Occupational Safety and Health Administration's Directorate of Standards and Guidance. Mr. Levenson has an extensive expertise on safety and health management systems, emergency response and preparedness, infectious disease, and protective clothing and equipment issues. Andy is also going to share more about the Occupational Safety and Health Administration, or OSHA's, rulemaking process and where the agency is currently at in that process as it relates to heat rulemaking. Andy, off to you.
Thanks so much, Augusta. If we can go to the next slide, please. So OSHA's activity on heat is distinctly different than a lot of the work that others are doing. When OSHA works on something in a regulatory framework, we are serving in part as a public health agency and in part as a civil rights agency. In that, when we establish mandatory minimum requirements, those are things that all employees can expect and that all employers must comply with. And that is distinctly different than doing guidance or best practice documents. As we're establishing a legal framework, there are lots of things that play into rulemaking. There are, of course, legal requirements, and I'll talk more about those later. But those legal requirements establish procedural requirements about how we interact with the public. They lay out benchmark requirements for technical issues. And there are, of course, politics and policy interest issues, as OSHA is part of the executive branch, and our leadership, both at the agency and at the department level, are presidential appointments. If we can go on to the next slide. So broadly speaking, OSHA's rulemaking process is laid out into 7 steps. In this first step, what we're doing is really engaging with the public and gathering information. In stage 2, a lot of the work that we do is behind the scenes, where we're taking the information, analyzing it, and deciding how we're going to move forward. Stage 3 really begins this process called notice and comment rulemaking, where the American public must be told what the agency is considering, and then, which is the notice part of it, and then we have to give the American public the opportunity to provide comment, and not only to provide comment, but to give them meaningful opportunities to comment, such that the agency is reviewing their information and responding to the comments, saying either we agree, here's why, or we disagree and here's why, and how we're going to use that information. That whole process happens in stage 4, which is where there are a lot of public engagement opportunities, and we'll talk more about that in a moment. Lastly, we then go back behind the scenes, start developing the final rule. We then publish it so that the American public again has notice of the new requirements. And then lastly, in stage 7, we move on to what are called post-promulgation activities. That's where we're giving speeches and webinars and talks to alert the public to the new requirements. We're doing compliance assistance activities to help people come into compliance, and we're setting up enforcement policy as well. If we can go on to the next slide. Now, OSHA's regulatory work is really governed by a wide variety of laws and executive orders and a number of court cases, the most notable being our Occupational Safety and Health Act. That's our North Star, but there's also the Administrative Procedures Act. There are a number of laws that affect how we interact with small businesses and create some special opportunities for engagement with small businesses. There are a number of executive orders that govern how we do things, and then there are a variety of court cases that have also determined how OSHA does rulemaking. At the end of the day, in the rulemaking process, what we're trying to do is show that the rule is reasonably necessary or appropriate. And what that means is that the action that OSHA is taking is going to substantially reduce or eliminate a significant risk of material impairment of health. Those are all terms of art that we get into in quite extensive discussions when we're doing rulemaking, but we're trying to eliminate the risk. A material impairment of health means that it's something that's beyond first aid generally. And the reasonably necessary and appropriate piece of that is that we can demonstrate the efficacy of the things that we're going to require employers to do, so that if people follow the standard, it will actually reduce the risk of the bad thing that we're trying to prevent. So in this case, prevent heat-related illness and fatalities. This is a gross oversimplification, but when we're doing health-related standards, there's a provision in the OSHA Act that requires that we control those hazards to the extent feasible, which generally means that we reduce it to the maximum extent, controlled by a couple of the technological and economic feasibility requirements I'll talk about in a moment. When we're doing safety standards, we're required to provide a high degree of employee protection. Technological feasibility is a requirement that means that OSHA has to look at all the different things that we're requiring and demonstrate that the employers who are complying with the standard or will have to comply with the standard can actually implement the things that OSHA is requiring. In terms of economic feasibility and cost effectiveness, that's not cost benefit analysis. While OSHA does cost benefit analysis for public policy reasons, that's not factored into our decision making. Economic feasibility generally means that we're not going to dramatically disrupt the composition of an industry. So for example, we're not going to drive all small businesses out of business. And lastly, the agency has to generally give deference to consensus standards, for example, ANSI or American National Standards Institute standards, unless setting its own standard better effectuates the purposes of the OSHA Act. So we've got to show that what we're doing better serves the agency's policy interests. Generally speaking, you'll see consensus standards adopted more often for things like personal protective equipment, and you'll see the agency set its standards typically for program-related activities. And then the last piece, all of the things that we're doing have to be supported by substantial evidence. So we're looking at the weight of evidence that's in the record, and do we have enough to move forward and make a decision? If we can go to the next slide. Now, during the rulemaking process, there are a number of places where we have stakeholder engagement. So the typical first step is either a request for information or an advance notice of proposed rulemaking. Those two are functionally very similar activities. In the case of heat, we've done an advance notice of proposed rulemaking. So we had a public engagement, and I'll talk a little bit more about that one in detail on the next slide. We also do stakeholder meetings where we have opportunities for both formal comments that people can submit to a record, as well as informal opportunities for people to stand up and speak. We are required in most cases to do small business engagement. That's an activity that's limited only to small business representatives and not open to members of the public or labor representatives. It's only for the small businesses. And then when we get to the formal proposal of a rule, that's where there's a lot of activity. So there's a public comment period, there's a public hearing. We actually have one going on right now on our COVID rulemaking, where we have an administrative law judge preside over the hearing, and people get to testify and be cross-examined. Then following a public hearing, there are post-hearing comments and post-hearing legal briefs. So there's a lot of information that goes into a rulemaking process. We can go to the next slide. When folks are participating in a rulemaking process, there are some things that make a good public comment, and there's some things that make a bad public comment. The things that generally are not helpful to the agency are simple statements like either we support the rule or we oppose the rule. When we're doing rulemaking, it's not a popularity contest, and it's really more an evidence-based process where we're looking at the weight of evidence. So some things that make good comments. Focusing on policy issues like the regulatory text. Is it clear? Does it include all of the provisions and requirements that you think should be included? Or do you think that some should be eliminated or reworded to allow people additional flexibility? Statements and information that address significant risk. So we always look at the peer-reviewed literature. So have we identified the right studies and the right information? But we also take anecdotal evidence from individual employers who can tell us, have their workers been hurt? What percentage of their workers? What sorts of injuries did they have? What sorts of costs did they have associated with those injuries? Any evidence or information showing the efficacy of a proposed rule is also very helpful. If you're an employer and you implemented a heat program to protect your workers, was it effective? Did you see a change in the rates of injuries and illness to your workers after that went forward? Issues related to technological feasibility and economic feasibility are also very, very helpful. How much would a standard cost if you put in ventilation or fans? Was it effective? And then how much did those things cost? So things that are very detailed information are all very, very helpful. If we can go on to the next slide. So where is OSHA in this process? We're still very much at the beginning in stage one. We published our advance notice of proposed rulemaking in October of last year, and the rulemaking record closed in January of last year. So we're still very, very early gathering information. If we can go to the next slide. On our heat rulemaking, we asked over 100 questions. Many of them covered scope, trying to make sure that we had the right industries and businesses and job tasks, so that as we were doing our analysis, we covered all of the right people, both for indoor and outdoor heat. We asked for information on existing efforts that people are doing, and we got over 1,000 comments from people providing information on this. If we can go to the next slide. OSHA, in this instance, also took the unusual step of creating an advisory committee to advise the agency on its rulemaking work. So this committee held its first meeting in February. It's got 15 different members from a variety of different industries, both labor and management, and they're advising us on both regulatory work as well as some of our guidance and outreach work. And you can see the URL at the bottom of this so that you can keep track of what this group is doing. If we can move on to the next slide. Now, while OSHA is moving forward as quickly as we can with our rulemaking effort, there are a number of other things that we're doing right now. So we have a campaign to educate employers and employees on heat stress. You can see that graphic on the left-hand side. We also do an awful lot of what's called compliance assistance, going out, doing speeches, educating, and helping employers and employees protect people now using guidance and best practices. And then lastly, OSHA recently announced an enforcement activity to use its general duty clause in a limited number of circumstances to really go after the most egregious examples of heat-related injuries and fatalities. You can follow all of OSHA's work at the URL that you see at the bottom of this slide. Another thing that we're doing, and if we go on to the next slide, this year we're doing a special stakeholder meeting that's actually next week. And we're going to be talking about both our prevention campaign, our compliance assistance activities, as well as our recent enforcement efforts. You can see our URL if you want to join that meeting. We previously had openings for people to speak, and we got so many that we closed the speaking opportunities, but we do have over a couple of thousand people signed up already to join us for that event. And the Secretary of Labor, the head of OSHA, our Assistant Secretary, Doug Parker, will be speaking, as well as a wide variety of agency folks, as well as us listening to what people have to say. And that meeting will be held on Zoom, and it's available simulcast both in English and in Spanish. And if we can go on to the last slide, the key point on this one is really the URL at the bottom. If you'd like to keep track of what we're doing on our rulemaking effort, you can go to that web link. And as things come up, speaking opportunities, opportunities to engage the public or new documents, those are all posted on that web page. Thank you very much.
Thank you so much, Andy. Next up, we're going to hear from Margaret Morrissey, who is the Director of Occupational and Military Safety at the Corey Stringer Institute. Margaret is also the president of the National Heat Safety Coalition, which is a new division of the Corey Stringer Institute that is entirely focused on preventing heat-related injuries and illnesses in labor. She also serves on different committees with the American Industrial Hygienists Association and the ANSI-ASP Heat Stress Management Standard for Construction and Demolition Operations. Margaret, I'll let you take it from here.
Thank you so much, Augusta. I apologize for the dark background in my picture. It's actually nighttime in Germany where I am. And I'm delighted to be here to present on the considerations for your heat stress management plan. So protecting workers from the dangers of heat. Next slide, please. And so Augusta already alluded to this, but I wanted to just introduce a new division of the Corey Stringer Institute, which is the National Heat Safety Coalition, which is created with a partnership with Mission and Magid. And not only do we provide occupational heat stress research, but we also provide heat safety solutions to specific businesses and services as well. So if you're looking to better tailor prevention strategies, and I'm very happy again to represent the Thermal Stress Working Group at AIHA as the secretary and part of the A1050 subcommittee for ASSP. Next slide, please. And so during the brief presentation today, I'm going to have two objectives. One being to help evaluate whether or not your work site needs a heat stress management plan, and also talk about considerations for implementing heat stress prevention strategies. Next slide, please. And so where to begin is really to determine whether or not you need to have a heat stress management plan. And so Brenda did an amazing job outlining some risk factors and vulnerabilities that people may have to heat strain. But a couple of examples that I want to provide that if this is occurring on your work site, then it's very likely that you'll need a heat stress management plan is hot environmental conditions, physically demanding work, especially for prolonged periods of time, insulating personal protective equipment, limited limited rest breaks. And also if your workers are reporting symptoms of heat strain or heat illness, heat injury, exertional heat stroke, then you absolutely need to have a heat stress management plan. And you also need to focus on the population of workers that you have and consider what vulnerabilities they may have to increase their risk to heat illness. Next slide, please. And so here I've really created a flow chart about what needs to be done once you determine you need to implement a heat stress management plan. And so the flow chart is a yes, no, and you see on the left side, even though if at a certain time you determine that your work site does not need a heat stress management plan, you absolutely need to revisit this question every 6 months, because just because your work site may not be experiencing heat stress, that doesn't mean it's not going to happen in the future, especially with climate change. So that's something you definitely need to consider. And so if you do determine that a heat stress management plan is appropriate for your work site, I recommend considering consultation as well as reviewing these heat safety resources. And what you'll need to do is begin by assessing a baseline of what you currently do in terms of mitigation strategies for heat strain. And then you'll need to define these strategies and then tailor these strategies specifically to your work site, the population of workers, the physical demands of the job, all of those considerations. And then once you implement that, you'll need to evaluate its effectiveness, but be prepared to have to recycle back if that plan is not effective, to redefine strategies and better tailor the strategies to, the work site and the physical demands. And so your big question is probably, okay, so how do I tailor these strategies to ensure that they are effective? And we have published a consensus document to help you work through this. Next slide, please. And so before I get on to that, I really do want to emphasize 2 levels of prevention that one of them is often forgotten. So if you look on the left side here, you have one level where it's preventing heat-related injuries and illnesses from happening in the first place. So this could including environmental monitoring, heat policies, work to rest cycles, things like that. So again, stopping it from occurring to begin with. But then you have to remember that nothing is 100% fail-proof. So you must be prepared to recognize and treat exertional heat stroke, which is considered a medical emergency. And so not only do you have to prevent a heat-related injury and illness from happening, but you need to prevent a heat-related fatality and be prepared to do that. And Dr. Doug Costa will be talking in the next session a little bit more about exertional heat stroke. So I recommend tuning into that as well. Next slide, please. And so bringing you guys back to the document I was talking about. So in September 2021, we published a consensus document that talked about strategies and resources to help protect U.S. workers from a safety, health, and productivity standpoint. And this document was really stemmed from a roundtable of 51 experts across different disciplines within the occupational safety or heat safety space. And so this document had 40 recommendations, and it was across 8 different categories of prevention strategies. Next slide, please. And so here are the 8 that is within the document. So heat hygiene practices. So that essentially means what can you do to make sure that your workers are tolerating heat, or what practices can help them do that. Hydration, heat acclimatization, environmental and physiological monitoring, body cooling, textiles and personal protective equipment, as well as emergency action plan implementation. Next slide, please. And so I want to mention just a few really quickly, although I wish I had more time, but just a few examples. So one would be a prevention strategy is heat safety education and training. So you need to have this during onboarding as well as have an annual training, because the research regarding occupational heat stress is continuously evolving. And so the education should have risk factors of illnesses, heat-related illnesses, injuries, prevention strategies, first aid, as well as emergency response procedures for heat illness. Next slide, please. And another thinking about considerations for hydration. You want to be able to educate your workers on how can they tell if they're dehydrated and what can they do themselves to help this process. And so examples on this slide here, they can pay attention to their urine color, pay attention to their urine frequency, reduce thirst sensation, as well as acute changes in body weight. Next slide, please. And also environmental monitoring. So many of you are aware wet bulb globe temperature is considered the industry standard. And environmental monitoring is so important because it really helps you create this environment-based work modifications. So that would be your work to rest cycles. And if possible, you should be measuring the environmental conditions on site so that it's representative of the actual conditions your workers are in. Next slide, please. And last thing I wanted to mention is an emergency action plan. And so what this essentially, and this is regards to exertional heat stroke. And so what needs to occur is you need to identify a work site manager, medical professional to work together to create, manage, and coordinate this emergency action plan. And it needs to be disseminated to all staff members. They need to have reviewed it carefully and rehearsed so that everyone knows what to do if there is an exertional heat stroke on site. And like I had mentioned previously, exertional heat stroke is a medical emergency. And so because of this, aggressive whole body cooling must occur immediately to prevent complications or even death. So just something I really wanted to mention. Next slide, please. And so thank you so much for having me. And I wanted to provide my email as well as the National Heat Safety Coalition website. And I'm happy to answer any questions through email as well. Thank you so much.
Thank you so much, Maggie. And next, we're going to hear from Dr. Maricel Pagan-Santana, who is a Senior Program Manager for the Migrant Clinicians Network in Puerto Rico. She leads and coordinates the Migrant Clinicians Network, current climate-related projects, and local health and safety programs, as well as provides technical assistance, training, and tool development for communities, health providers, and workers. Dr. Pagan-Santana, I'll pass it off to you now.
Thank you. I want to continue the discussion and go, first of all, good afternoon, everybody. My name is Maricel Pagan-Santana. I want to continue this discussion and into a more deepened way in terms of the other characteristics that can put workers, especially migrant workers, in jeopardy when we talk about heat-related illness. So we want to talk about other stakeholders that can support these programs in addition to the national standard. Next slide, please. MCN, or Migrant Clinicians Network, is a national collaborative. We work to provide capacity building and technical assistance to communities, health departments, and other agencies, especially clinicians, to target vulnerability, immigration, and health, including occupational health. Next slide, please. We're located throughout the states, including San Juan, Puerto Rico, where I'm located, and we work in several topics regarding migrant population. Next slide, please. We work with underserved migrants and immigrants, clinicians, migrant and community health centers, state and local health department. And I want to stop right here and talk about clinicians specifically. When I refer to clinicians, I refer to the whole theme of providing health services, not only physicians, but nurses, community health workers, health promoters, and etc. So we want to talk about the whole team in terms of who can be supportive of heat illness prevention programs to both employers and employees. Next slide, please. And we have been hearing throughout the day the heat illness can kill a lot of people, and we know that can kill more people than hurricanes, floods, and tornadoes. So when we talk about climate change and heat, we need to be addressing this issue as one of the most important things regarding occupational diseases and exposures, and especially for those workers that can be more vulnerable than others. Next slide, please. So who are those more vulnerable? We saw in a previous presentation, the people who work outside, people with lower socioeconomic status, children, pregnant women, chronic illness, and migrant populations as the most vulnerable for heat-related illness. Then I'm gonna focus on the migrant population. Next slide, please. Just so we can put in perspective and context, we know that 7% of the immigrants in the United States are classified as essential workers. And I want to talk about this because it talks about the perception that we have of these essential workers, including agricultural workers, and how they perceive themselves in being treated such as, meaning, are we treating them as essential workers, and how do we move forward to consider them essential? Next slide, please. Just a story from the field, you can see that, and I'm gonna read this, quote this, you hear the job that we do is essential, but you realize as a worker, you're not treated as essential, you're treated as dispensable. And that let you know how workers right now, migrant workers and agriculture workers, feel regarding how we move forward to protecting their life, and how we, even though we are talking about essential workers, the protections that we have in place and the programs that we have in place are not perceived as somebody who is considered essential. So we need to start changing that mindset, and we need to move forward with programs and systems that address and treat those workers as essential workers as they are. Next slide, please. Who are the agricultural workers that we're talking about? We're talking about that 60% of them are Spanish dominant as a first language. Most of them are foreign-born, coming from Mexico, and 37% come to work without authorization. And we need to know about this, because this will create additional burdens that will relate to how they can access care when we're trying to target heat-related illness and treatments. So, and another piece that we want to take in consideration when we do programs that are tailored in literacy, cultural appropriate for these populations, that even with this with these numbers, we need to consider that that 64% from Mexico not necessarily is going to be Spanish-speaking population, because we haven't been receiving people who are coming from the indigenous communities of Mexico. So having programs that are tailored to address heat and other occupational exposures means that we need to continue to do capacity building and continuity education for clinicians and workers who are doing or are in charge of the health and safety of these workers to address specific cultures limitations. Next slide, please. These workers also have, on average, a 9th grade education. We have people who have income below the poverty level, 21% of them, and who will likely not have insurance or health insurance at the possession. So we have limitations in their access to care and how they can get treated and who treat them in case they have an exposure. Next slide, please. In addition, we have programs that keep, we have a flow of employees that keep coming to the United States, including Puerto Rico, to different programs. So we have a consistent flow of migrant populations coming to the fields who are going to be exposed to this climate crisis and heat-related exposures. Next slide, please. When we talk about structural impacts, we need to consider too that we're not talking just about being on the field. We're talking about discrimination, language, continuity of care, regulatory issues, and immigration status. So when we consider heat and we consider exposure, we need to consider two living situations and physical health and work when we're trying to do something related to heat and prevention. So that relates to when we are talking about having a heat prevention and management plan or an emergency management plan for heat-related emergencies, we need to figure out what the structural issues our population has so we can have an effective plan, effective training plan, and effective action time to address those. Next slide, please. Next slide, please. I'm gonna just share with you guys some story for the field so you know that how these characteristics can become an additional burden to the employees when they're in the field. We have workers that have been in field and can see their colleagues or other staff in the field faint or having some ill-related diseases and seeing how they're taken away, but they don't have any emergency system in plan. So it's not just about we knowing that happens, it's that they can see it and they have the additional challenges of how they can address with their employers taking an action plan on heat. Next slide, please. This other story regarding a farm worker in the heat addressed some of the issues that were mentioned before about being scared or being afraid of losing their job because of asking for heat-related provisions or protections. In this case, they're talking about asking for breaks and how they don't have breaks in their area of work and how they can be scared into not asking for those, even though they are acknowledging that they need to have those breaks to be able to continue working and not have heat-related consequences. Next slide, please. Final story, we got the story of Asociación Valdivia. This is a worker that died trying to, suffering for a heat-related stroke, and there was legislation introduced, but we haven't seen anything related to that. And I'm gonna move forward so I can actually get to the role of clinicians. Next slide. We discussed this previously with other presentators. That only a few states have heat stress standards, and there's not federal heat standards. That's one of the limitations to targeting agriculture workers. Next slide, please. We need a national standard, and we need to go beyond the long history of agricultural exceptionalism. We know that we usually systematically exclude these protections for workers, and that can be even more difficult for migrant population of workers, as we know that this exposure and this risk is going to intensify further. Next slide, please. And I'm going to go really quickly over the role of clinicians and resources. I think in terms of engagement, and when we talk about having a national standard, we also talk about having stakeholders in this process. And one of those stakeholders are clinicians, including community health workers, health educators, and physicians, in how we get those workers to understand their heat-related illness and how can then provide it to them. Next slide, please. We got some challenges that we need to address in these systems and the work that we do, including continuity of care, including culture and language. So we need to work to have appropriate programs that can address those populations. Next slide, please. We also need to address cost and operational challenges for those health centers and clinicians to be able to address rural populations and have limitations in transportation. So we have several ways to address those. Next slide, please. The way to do that is to do cultural adaptations in our programs, mobility adaptations, and appropriate service delivery. Like, for example, cultural and sensitive education. It's just not about having education and training. It's about having education that can be effective, and it can be related to the literacy levels and cultural health belief of those populations. Having a bridge case management for those workers that move from site to site that can be monitored, and case management and mobile units for those that are hard to reach or are in rural populations. Next slide, please. And we can continue to advocate for policy and change, training workers and clinicians as something critical. I want to move to the end of the presentation, if you can, please. I know they have several transition animations, but I just want to show that MCN has a health-related clinicians guide that we want to share with you in terms of including stakeholders and letting them know that they have to a part in this process of prevention and health-related illness for agricultural workers. Thank you.
Thank you so much for sharing that very important information and perspective with us. And thank you to all of our panelists for joining this conversation, especially on Workers' Memorial Day. And with that, Hunter, I will pass it back to you.
Thank you very much, Augusta. And to continue the focus on preventing exertional heat illness, we will now explore how to protect athletes, military personnel, and others engaged in outdoor activities from heat. I'm pleased to introduce our moderator, Kim McMahon, the NOAA National Weather Service Public Weather Services Program Manager, guiding national policy involving extreme temperatures, wind, and health-related weather phenomena. She started her career as a meteorologist for the Weather Service in Albany, New York, as a student employee. After graduating from the University of Albany, she accepted a forecasting position at Dugway Proving Ground under the Department of the Army. In the years following, she rejoined the Weather Service, working as a forecaster at several weather forecast offices across northeastern US. During this time, she also earned a master's degree in executive leadership. In 2017, Kim transitioned to focus on programmatic policy as the National Weather Service Eastern Region Tropical, Marine, and Tsunami Program Manager, overseeing weather forecast offices stretching from Maine to Ohio to South Carolina. She accepted her current role as National Public Weather Services Program Manager at NWS headquarters in 2020. And with that, Kim, over to you.
Thank you, Hunter. Continuing the day's theme of building equitable human resilience, this next session will focus on our active outdoor populations. This includes high school and collegiate athletics, marching bands, marathon runners, and the military, just to name a few. While these communities are generally thought to be composed of healthy individuals, their exposure to heat puts them at unique risk. So we asked the question of how to protect these individuals. And I'd like to start by talking about the wet bulb globe temperature. So next slide. This is going to be a quick overview of wet bulb globe temperature, as it's already been mentioned by a number of people the past couple of days. Next slide. So what is the wet bulb globe temperature? It's an index of heat stress invented in the 1950s for the US Army and Marine Corps as part of a campaign to limit outbreaks of heat illness in their training camps. The wet bulb globe temperature utilizes 3 different thermometers as seen on the right-hand image. These are the black globe for solar factor, which including sun angle and cloud cover, the wet bulb temperature for humidity, and the dry bulb for your ambient air temperature that everybody's familiar with. So these account for variables in the diagram on the left-hand side, temperature, solar radiation, relative humidity, along with wind speed, which is obviously measured by an anemometer. I do want to note that the wet bulb globe temperature is not directly comparable to air temperature or a heat index scale. For example, wet bulb globe temperature values of 90 or greater are dangerous for strenuous outdoor activities. Meanwhile, in, for example, Florida, that's just another typical summer day if you're talking about regular air temperature. So next slide, please. The wet bulb globe temperature does differ from heat index. I'll go a little bit into that in a minute, but I do want to note that it doesn't replace heat index as far as index being used by the National Weather Service to gauge heat stress. Each of these has their strengths and limitations and different roles. So it's really important to emphasize that it's another tool in the toolbox. You can see on the right-hand side that table that depicts what the wet bulb globe temperature takes into account versus the heat index. While both take into account the temperature and the relative humidity, the wet bulb globe temperature is measured in the sun, and you combine that with the cloud cover and the sun angle, so you get that solar radiation factor. While the heat index is generally measured in the shade. The other significant difference is that wet bulb globe temperature takes into account an actual measurement or forecasted wind speed. Now, this is not to make heat index sound super lacking, because the heat index does take into account a wind speed. It is just a constant assumed wind speed of around 5 to 6 miles per hour. So some other important differences is that the wet bulb globe temperature was designed for those active outdoor communities that are acclimated to the heat. It is very sensitive to land cover, and some of the presentations we saw earlier today and yesterday, you noted that when there were infrared thermometers showing different types of land cover, grass versus a pavement versus those newer playground surfaces, Some of those surfaces did increase the temperature or show a temperature of about 125 degrees Fahrenheit. So that will certainly impact the reading of wet bulb globe temperature. It's very localized, very sensitive to those land cover. The heat index does take into account more assumptions and set parameters such as body mass and height. So a 5'6" adult, around 148 pounds. Their activity level is just a leisurely walk of about 3 miles per hour. And it's assumed that they're wearing trousers and a short sleeve shirt. And like I said, with that wind of about 5 to 6 miles per hour. So next slide, please. So while we have heat index and wet bulb globe temperature, we generally use heat index at the Weather Service to communicate to your general public. The wet bulb globe temperature, again, being for those acclimated, healthy, physically active outdoor individuals, such as the military, outdoor workers, athletes in marching bands, and those doing strenuous outdoor activities can benefit from utilizing the wet bulb globe temperature, given that they are, I want to say, acclimated. So your weekend warrior of, I'm just going to go for a run on the weekends, but always be indoors in cool AC for the rest of the week, may not quite benefit as much. So next slide. And the real key, I would say, with wet bulb globe temperature is that it really can be utilized to establish guidelines for activity modification during for those who are doing physical activity in the heat. These guidelines, keep in mind, will vary geographically since temperatures do fluctuate by region. We have those climatologies for a reason. And then people's response to the heat will also vary by region that they are acclimated to. So for example, somebody in northern Maine is going to be not so acclimated if they take a trip to southern Texas. So, and I just, again, want to reference the fact that wet bulb globe temperature is designed for active outdoor communities and those who are acclimated. So next slide. Now for Weather Service, we have wet bulb globe temperature forecasts that are based on our other elements that we forecast every single day out to 7 days. So that would be temperature, relative humidity, wind, and sky cover. So that is used in combination with sun angle for that solar radiation. And there's a URL. But if you go to the next slide, and I'm sorry, I'm going quick to try to make up for time. We do use the wet bulb globe temperature climatological regions. You probably noticed on the other slide the different colors, green, yellow, orange, red, and that black/dark gray color. Those color bin thresholds are based on Grunstein and All's work from 2015, which correlates to the wet bulb globe climatological regions. And those are widely accepted across the nation. So if you want to view our forecasts, you can go to digital.mdl.nws.noaa.gov. That's a mouthful. So if you want more information and an easier URL to remember to get there, weather.gov/safety/heat. Next slide. And as I stated before, the really great part about wet bulb globe temperature is how it's used to create local activity modification guidelines. Always check with your local public health and/or athletic officials, because in this example, we've got Minnesota on the top right, and we have North Carolina on the bottom. If you look at the red, for North Carolina, those red high flag thresholds start at 88 wet bulb globe temperature. And that means athletes must be under constant supervision, remove pads and equipment. But then looking over at Minnesota, we've got North Minnesota and Southern Minnesota, where in the north, that starts at 83.5, so roughly 84, where no outdoor workouts or non-air conditioned indoor workouts can be done. So really understanding that it's not just a number to focus on, it is understanding the impacts and therefore setting the appropriate modification guidelines. So last slide. I hope I've brought us back some time, but if you have any questions, you can email me at kimberly.mcmahon@noaa.gov. Now it's my privilege to introduce our next speaker, Dr. Douglas Casa. Dr. Casa is the CEO of the Corey Stringer Institute since its foundation in 2010 and is a professor of kinesiology since 1999 at the University of Connecticut. The mission of the Corey Stringer Institute, KSI, is to provide research, education, advocacy, and consultation to maximize performance, optimize safety, and prevent sudden death for the athlete, warfighter, and laborer. Additionally, he is the editor of a book titled Preventing Sudden Death in Sport and Physical Activity, published by Jones and Bartlett in cooperation with the American College of Sports Medicine. Dr. Casa has published over 350 peer-reviewed publications from books chapters and presented more than 600 times on subjects related to maximizing performance in the heat, exertional heat stroke, heat-related illnesses, preventing sudden death in sport, and hydration. As a licensed athletic trainer, Dr. Casa has successfully treated 337 cases of exertional heat stroke with 0 fatalities. As a long-standing and one of the first private sector partners with NIHHIS, KSI spearheaded an effort that brought together the DoD, CDC, NIOSH, OSHA, NOAA, and university partners to address heat activity guidelines across athletic, military, and occupational settings, and called for an increased coordination on the topic. It's my privilege to hand the floor over to Dr. Casa.
Thank you, Kim. All right, can you guys hear me okay? If there's a way to...
You sound good, Doug.
All right, thank you, I appreciate that. That was a great presentation, Kim, and thank you for that intro. One just thing to add on to the great information Kim shared was WBGT, to make sure you're measuring that on site on the actual field you would be playing on in an athletic setting or actual work setting for a laborer, and not using just forecasts, because like an artificial turf field at a sports field could be very different than something you're getting from 20 or 30 miles away. So in hot, extreme environments, we really recommend that measure being done on site. We've had great success in athletic environments with dramatically lowering the incidence of heat illnesses when appropriate work to rest ratios were used and modifications were implemented based on the environmental conditions, as high as 80% reduction in one study during certain wet bulb globe temperature ranges. So I just wanted to share that. So here you can see I'm going to talk about maximizing performance and safety during intense exercise in the heat. You go next slide. As was mentioned, I'm not going to read it again. That's our mission of the Corey Stringer Institute. We were founded in 2010. Some of the older people on this session right now will remember the great Corey Stringer, who played for the Minnesota Vikings, passed away in 2001 from a heat stroke. We were founded in 2010, trying to honor his legacy by trying to keep others safer and preventing that same thing that happened to him. Next slide. Boring slide here, a university requirement. I have to release all my disclosures. These are the 9 corporate partners of KSI and other places in which I receive income. Next slide. I know this has kind of been mentioned. I'm not going to do a great dive on this right now, but it's really important to understand how a human loses heat during intense exercise in the heat, because in certain circumstances, some of these could be impeded or some of them can be maximized. Or things you can do to maximize some of those. So certainly evaporation, especially during intense exercise in the heat, is going to be the key one, especially when the environmental conditions are higher than your skin temperature, which would basically negate convection, conduction, and radiation and leave us with the evaporation of sweat into the air for us to lose heat. But then obviously in humid conditions, that will also be impaired, of which we need to have more special precautions in those circumstances when it's hot and humid. Next slide. So I want to get into what are the factors that contribute to a heat illness. So we got to be aware of these things so that we can then make modifications or consider all of the factors that we have possibly can change. Some things we can't change in certain circumstances, but some we certainly can. So here you can see a list. It was certainly covered already. The temperature and humidity, someone who gets dehydrated, direct sun exposure versus, someone having shade or cloudy conditions, limited air movement. When intensity of activity is the key driving factor of the rate of rise of your body temperature, even more so than environmental conditions. Poor workplace regulations, whether it be education or implementing proper work to rest ratios or having hydration close by, things like that. Obviously, the protective equipment and clothing can be impediment. And individual characteristics, someone with a history of heat illnesses, taking certain medications or supplements, someone's fitness level is low. Those are all things that can enhance or increase the likelihood of a heat illness. Next slide. So to that end, I just want to do a brief overview of some of the heat illnesses. I'm not going to do a super deep dive. There is a resource I will point you to if you want additional information. And the one Maggie noted earlier in her presentation, the overview article, the consensus statement that we published last summer is certainly a good resource as well. Next slide. So 3 of the most common heat illnesses I'm going to mention are heat syncope is one. It's when someone faints, more likely when they're exposed to the sun for a long period of time, they get dehydrated, especially when they've been doing a lot of exercises and then stop suddenly with this pooling of blood in the lower body. It's relatively easy to treat with the feet being propped. I'm not going to get into great depth. The greatest risk with someone having syncope is the actual collapse itself because of obviously the injuries that they could, sustain when that happens. Next slide. Heat exhaustion, certainly not dangerous, but it will certainly be an impediment to the worker or athlete's performance. But it is also very much a warning sign that the person is struggling, right? So we want to get them out of activity. We want to keep them out of activity for the remainder of that day, at least get physician clearance for returning. Same kind of treatment as syncope, cooling someone down, propping their legs, hydrating them, and letting them rest and removing them from continued activity, at least for that day. Next slide. The one that scares us all is exertional heat stroke. Exertional heat stroke occurs when someone's rate of rise of body temperature exceeds the rate of which they're losing temperature. So it's not a failure of their thermoregulatory system like you see in classic heat stroke. It's an overwhelming of the thermoregulatory system. More heat gained than lost in a given period of time. So these are the things we have to try to modify behavior to prevent this from happening. But if it does present itself, we have to recognize it quickly. And we have to cool somebody down as fast as humanly possible. In an athletic setting like high school, college, pro settings, they would have cold water immersion tubs set up on site and cool the person on site until they're down below 103. And then they would send them to the hospital in an ambulance. That concept is called cool first, transport second. There's a hyperlink here on the bottom of this slide. That's a 12-minute educational video that we spent a lot of resources on to produce. The NFL produced it, but we've marketed it, to high school, college, and really anyone who can benefit from having the information. It's an actual how-to video showing actual scenario take place. Next slide. So signs and symptoms of exertional heat stroke can be very similar to syncope or heat exhaustion or even a head injury if you didn't witness it or other conditions. But the 2 key diagnostic criteria of heat stroke are extreme hypothermia at the time of collapse. And that has to be measured with an accurate measure like a rectal thermometer, not things like tympanic or axillary or oral ORAL or AURAL. And altered consciousness. So some kind of CNS dysfunction. They don't have to be unconscious. Like they just could have be super lethargic. They could be combative. They could be confused, really slow answering questions, inappropriate answers to questions. Something is just out of sorts. Something is different. If you suspect something's wrong with one of your athletes or a colleague, or assume heat stroke if they've been doing intense exercise in the heat, especially if you rule out cardiac, and then start cooling as fast as possible. Next slide. So why we cool as fast as possible is we have a 30-minute window to get their temperature down under 104 within 30 minutes of collapse to assure survivability, at least in over 2,000 cases that we've tracked. That's our goal. We got to get them, and cold water immersion has the fastest known cooling rates. So whenever it's possible, we want people using cold water immersion. There are other things that are effective, but often they're only about 2/3 as effective. So we give up minutes. So you can see if you go beyond the 30 minutes, now the possibility exists you'll have long-term complications, permanent complications, and as you know, death as exertion heat stroke is consistently one of the 3 leading causes of death in sports, military training, and for laborers. So it's ever present, and we need to be prepared for mechanisms to prevent it in the first place and to treat it if it presents itself. Next slide. Not going to go in great depth here. It's a follow-up. I wanted to just let you know this is a resource published in Pre-Hospital Emergency Care 2018. A bunch of emergency room physicians and other heat stroke experts came together to really re-emphasize the concept of cool first, transport second. 3 states in the country right now actually mandate this for EMT EMS services, that cooling will continue on site if a licensed medical professional is providing appropriate care to get a heat stroke down before sending the person. But we need people, if they're effectively being cooled by a medical professional, to allow that to continue on site and then the transport. Next slide. So when we're talking about exercise performance in the heat, so we're talking about obviously safety is a huge issue, but we also want our athletes and whoever they are, laborers, whoever we're talking about, to enhance performance during exercise in the heat. One of the tools we have access to is acclimatization, right? Phasing in people's activity in the heat. So here you can see red, that's how you perform when you're first exposed to heat, to an hour of hard exercise or 100 minutes of hard exercise. Orange after about a week, green after about 2 weeks. So after 2 weeks of exposure to heat and exercising in the heat and getting your body temperature up and getting used to it, you're close to actually being able to perform as you would in a cool environment, but it takes time. That's why our greatest risk of heat stroke is in the first 3 to 4 days of new activity in the heat, new exposure. We're not heat acclimatized yet. We don't have also don't have the behavioral strategies yet. Next slide. I'm not going to do a great big dive here, but this is an example of just one study that showed that heat strain is exacerbated on the 2nd consecutive day of fire suppression. And it's just an example of that when someone goes back into exercise in the heat on a day 2 after having a really tough day on day 1, their body temperature rises faster and they struggle and they don't do as well. Next slide. This is an example just of some of that data pre-post on day 1, and then showing that they just don't do as well during some of these exposures. And it's similar even after someone gets heat acclimatized. So when you have really hard activity on day 1, your body often will need some kind of recovery period. And we need to just be sensitive to that. That's why I said the first 3 to 4 days really risky in terms of heat stroke. So we need to factor that in, that there's going to be increased risk. Next slide. Similar findings by Rihanna Pryor at SUNY Buffalo, showing that 22% less time to reach exhaustion on day 2, 18% faster rise on day 2, just showing again that day 2 versus day 1, doing the same exact activity in the same environmental conditions, people do not do as well. Next slide. So other heat mitigation strategies, I mentioned heat acclimatization, but the other key ones, I'm not going to have time to get through everything right now, but fitness is the most important heat mitigation strategy. We often tell people get fit first before worrying about getting heat acclimatized, because fitness is far and away the most important factor. We're always thinking, oh, let's keep them hydrated, let's keep them cool, let's get them acclimatized, all super important, but fitness is more important than all 3 of those factors. Fitness, enhanced fitness enhances your exercise heat tolerance, and it's the most important factor. Next slide. So this shows you after someone gets heat acclimated, like enhancing their power, their time to exhaustion, their VO2 max time trial. It just shows you overall, you see performance enhancement in all of these factors after someone just goes through 10 days of exercise in the heat. So your athletes are going to perform better. But they're going to be at risk in those first few days, but they will obviously see the benefit if we can help them safely navigate that process. I'll just do a couple more slides. Next slide. This is just theoretical framework on compensable heat stress. That means that your body temperature is rising faster. You're gaining more heat than you're able to lose over a given period of time. And what are the strategies you utilize to help prevent that? Hydration, heat acclimatization, and body cooling strategies. Next slide. Next slide. So just to reiterate here, I do have some more detailed slides, but I'm going to just end it here to just reiterate the key points. Heat acclimation, which I discussed, phasing in activity over time over the first couple of weeks when you're onboarding an athlete coming back from an injury, a vacation, anything like that, or just phasing in activity in the heat during summer training. A key factor, hydration. Have them check their urine color in the morning when they wake up, or their body weight or their thirst levels. First morning voids and weights and thirst measures are super important, but they can also check urine color throughout the day. Body cooling strategies. Cool during any break periods. Use shade, use cold wet towels during break periods. Pre-cool during hot activities when that could also be helpful. And then, as I mentioned already, fitness, get fit first before trying to implement these other strategies. All right, I'm going to end it right there. Thank you, Kim.
Thank you, Dr. Casa, and I appreciate you being able to speed things up. So apologize for the crunch time. Next, we have Lieutenant Colonel David DeGroot, PhD. He's the director of the Army Heat Center at Fort Bennington, and he directs efforts aimed to prevent heat casualties through education and training, development and sharing of medical management best practices, and conducting clinically meaningful research. Lieutenant Colonel DeGroot's research focuses on environmental physiology, injury prevention, and human performance optimization. He's a member of the Association of Military Surgeons of the United States, AMSUS, the Society of Federal Health Professionals, the American Physiological Society, or APS, and is a fellow of the American College of Sports Medicine, or ACSM. His education includes a bachelor's in physical education, a master's in exercise science, and a PhD in physiology. The author of over 90 research articles, government technical reports, book chapters, and conference presentations, Lieutenant Colonel DeGroot has received research awards from the ACSM, Environmental Physiology Interest Group, the APS Environmental and Exercise Physiology Section, and the Army Public Health Center. So take it away, Lieutenant Colonel DeGroot.
All right, thanks, Kim. Can you hear me okay? Audio all right?
Yes, you're good.
Yes.
Okay, good. Thank you very much. And thanks to Dr. Casa for his presentation. Actually, a number of the topics that he talked about kind of helped set the table for some of what I'm going to talk about, what we're doing here at Fort Benning, Georgia. And one thing I want to point out is that what the effort I direct is the Army Heat Center. So I'm located at Fort Benning, but we actually have a mission to provide support in various ways across, actually not just the Army, but as a tri-service approach, also providing support to the Navy, the Marine Corps, and the Air Force. They don't have a comparable effort here, so we support all of those. So if we can go to the next slide, please. So just a quick overview about Fort Benning. You see on the map here where we're at. We're right on the Alabama border. For our college football fans, the nearest larger city is Auburn, Alabama, about 30 miles from here. So, but Fort Benning is the home of the Maneuver Center of Excellence. Now, what's Maneuver Center? So if you're going to be either an officer or enlisted soldier who's serving in the infantry or armor, this is where all of your military training and education takes place. So while there's 11,000 or so permanently assigned military individuals like myself who just regularly work at Fort Benning, an average week has over 16,000 additional trainees, and on an annual basis, 80,000 or so trainees a year pass through Fort Benning, whether it's initial training, whether it's for airborne school, Ranger School is here, and a number of other professional military education classes. Go to the next slide, please. Just to talk about the epidemiology of heat illness in the military, a significant challenge for us. We have a number of In terms of mission constraints, the uniforms we wear, the protective equipment, train as you fight. So our soldiers are going to be training wearing body armor, which has a metabolic cost because of the weight of it, but it also comes as a barrier to the evaporation of sweat. And as Dr. Casa talked about, the avenues of how we lose heat, dissipate heat, and that our clothing and equipment can be a barrier. And you see here, why is my effort here at Fort Benning? You can see over a 5-year period, we have the unfortunate distinction of saying we're number one when it comes to just the frequency. This isn't a rate or an incidence rate. This is just a straight frequency case count across the entire Department of Defense. Fort Benning is unfortunately where it's at for heat casualties. So that's why we're here in an effort to help drive those numbers down. So if we go to the next slide, please. Our effort here is far from new for the military. The US military's interests in heat stress and health and performance literally goes back 100 years. One of the foundational labs in just the field that's become known as environmental physiology was the Harvard Fatigue Lab. That interwar period and up through World War II was a lot of their work was funded by what was then called the War Department. And you see here other labs throughout the years. And now more recently, since 1961, and actually where I got my start, my military career started, the Army Research Institute of Environmental Medicine has been operating in Natick, Massachusetts since the early 1960s. So if we go to the next slide, please. So a little history about specifically to the heat center. Unfortunately, tragically, we had a exertional hyponatremia death in 2016 in a Ranger School candidate. And the big challenge we face here is constant turnover of personnel. On the civilian side, you have individuals responsible for events, and I'll actually go back to Dr. Casa. I know he's been involved in Massachusetts in the Falmouth Road Race for many, many years. There's a continuity when you have that sort of thing. Military life doesn't lend well to that because we've got constant turnover. Out there in basic training land, the drill sergeant does drill sergeant duty for 2 years, and they go back to their primary MLS. So every 24 months, you've effectively had 100% turnover of all personnel. So our education efforts can never stop because institutional memory almost really doesn't exist. So they started the Ad Hoc Heat Center in 2016, 2019 with my arrival and appointment as the director. We were kind of formally established and we operate a heat clinic here. For any clinicians in the audience, you see this URL here. There are a wide array of resources, treatment algorithms, practice recommendations from a military perspective, but still certainly useful in the civilian environments. Just go to the next slide, please, to tell you a little bit about what we do at the Heat Center from a broader perspective. Is we have, I'm using my old, sorry, I'm a military officer. I'm going to use military speak and talk about lines of effort. And we have 4 here. First and foremost, it's prevention. We always want to do whatever we can to prevent heat casualties. It's always cheaper to prevent than it is to treat. And that's where we provide training and education. And that was hinted at in other talks, where we don't have enough medical personnel. Fort Benning is 200,000 acres, literally hundreds of training events spread out over the entire Fort Benning footprint every day. And Fort Benning, the Army doesn't have enough medical resources. So we need to train our drill sergeants and other instructional cadre on recognition and response. Dr. Casa nicely covered it in terms of that initial response and the importance of cooling. We rely on our drill sergeants and cadre to be that frontline responder, and they do a great job, which is covered here in the next, where we talk about management. That pre-hospital cooling You'll see a lot of different numbers actually on heat stroke mortality in the civilian world. There's actually OSHA data that has 80%, but that was a result of investigations of workplace deaths. So there's a little bit of a selection bias there. Over a 10-year period here, 0.3%. And when we do have one of those fatalities, it's attributable to some human error and a failure to follow established protocols. It's not that what we didn't work, it's that the personnel on the ground at the time didn't do the right thing. So we figured it out, but it's always that challenge, especially with that turnover of personnel, that education always continues. On my earlier slide, I mentioned the Army Research Institute of Environmental Medicine up in Massachusetts, a long history of work in heat, cold, and altitude on human health and performance. They've never had access to that clinical population. And of course, there are the ethical constraints. We can't induce heat illness experimentally. We have to rely on opportunities where the heat casualties occur. So they're a key research partner of ours that we can translate that, for, take it from bench to bedside, so to speak, of those lessons learned, and developing best practices and getting that stuff into the scientific literature. So that's a large part of what we're doing here is research effort, and then taking all of this and translating it to policy. So we have in the military a document, Technical Bulletin Medical, number 507. It's heat stress and heat casualty management. So from the Army Office of the Surgeon General, so this isn't the US Public Health Service Surgeon General, the warnings on packs of cigarettes. This is the Army Surgeon General. So similar type of position of a senior medical advisor, but it's at the Army level. It's a policy statement on how to prevent. So we inform that. We actually, myself and some of my colleagues, help write that document when it was recently revised, that we take those lessons learned here at Fort Benning and other places, Marine Corps Recruit Depot, Parris Island, and Quantico Marine Corps Base, and other locations, put that into policy so that other installations, and actually that regulation, you can just Google TV Med 507. It's publicly available. There's nothing secret about it. It's available out there as a resource. So let's go to the next slide, please. This is a preview of a paper we have coming out from here at Fort Benning. So the Medical Surveillance Monthly Report. So I'm sure a lot of this audience is very familiar, of course, with the CDC's Morbidity and Mortality Weekly Report. Well, the Department of Defense publishes a monthly that's very much analogous to that, where it's your injury and illness surveillance reporting, and that's our Medical Surveillance Monthly Report. And this paper will be coming out where what we're most concerned with is heat stroke and hyponatremia. Those are the ones that are potentially fatality producing. As Dr. Casa talked about, heat exhaustion is much less serious. We're not concerned about those rising numbers. Right? So, oh, well, look at those numbers though. Those have really gone up. We actually view that as a positive because that indicates that our drill sergeants and other cadre are doing a better job at recognizing the initial signs and symptoms and intervening before it progresses into something worse, like a heat stroke event. So we're not concerned about that rise. And we are pleased to see that after a big spike in 2018 and 19, we're bringing our heat stroke numbers down. It's way too early in 2022 to speculate on where we're going to end up this year. But this is another data where we also look at event types that we've learned that for example, last year, those 51 heat strokes, 41 of those occurred during running events or foot march, ruck marching events that were timed. The individual was having to perform against the standard, whether it's the 5-mile run on day one of Ranger School or the 16-mile foot march at the end of infantry basic training. There's a standard they need to meet. So there's an external motivational factor that individuals may not listen to their bodies and keep pushing themselves and they're not listening to the bodies. What's our natural behavioral response to the heat? It's to slow down. Yet they feel pressure that they can't do that at that time. So we see a lot of these occur during those types of events. And that then informs those unit leaders, what can they do what other things can they do to focus their prevention efforts to drive those numbers down. So with that, I think I would go to my last slide. I think that's it. I've got my, I'm easy to find with our contact info. There, on an earlier slide, there was that website, our Warrior Heat and Exertion Related Event Collaborative website. There's an Ask the Expert function there, and anything heat related ends up in my inbox. So with that, I'll conclude my presentation, and I do believe that we do have some time for questions and discussion, not just for myself, but for the other presenters. So I'll turn it back over.
Thank you, Lieutenant Colonel DeGroot. We do have time for some questions. And just as awareness for everyone, we will be, Morgan stated earlier, we will be sharing the slides after the meeting. So we have our three presenters for this round. And the first question we have is there a criteria to determine if a heat stroke patient is beyond or within the window of being cooled in the field before transport? I think this goes to Dr. Casa.
Kim, could you say that one more time? Sorry.
Yes. Is there a criteria to determine if a heat stroke patient is beyond or within the window of being cooled in the field?
Yeah, that's a good question. The key thing is obviously getting their body temperature. If someone's body temperature is above like that kind of key cellular damage threshold, like so something above 105, we would definitely want to be cooling that heat stroke person in the field. A recent study we published of 274 heat strokes, the average start was 108 degrees. So it gives you an idea of what a beginning temp is. So they could be 112, 110, 106, but we would want to initiate cooling, preferably with obviously a really effective cooling modality. And 15 to 20 minutes, we can probably get them under the 104 range for most starting heat strokes and then transport after.
Thank you, Dr. Casa.
Yeah, and if I can chime in real quickly on that, because we operate in an environment where we don't have enough medical personnel out there, and we only want, as Doug correctly mentioned, we rely on something like a rectal temperature, not an oral or a temporal temperature, and we only want medical personnel doing that. So what we train our cadre is, when in doubt, start cooling them. And the reality is, if they didn't need cooling, well, all we've done is made them a little bit cold, and we can warm them back up. There's no harm from a mild hypothermia of dropping them to a core temperature of 95 or 97. It's kind of a so what, we'll warm them back up. They're cold and cranky and they're not happy about it, but we haven't done any harm, and it's much better to err on that side of caution than to failure to respond and not cool someone who needed it.
Yeah, that's great. It's great advice, because no harm in cooling a heat exhaustion person down who will still benefit, and feel better from the cooling, and to never miss a heat stroke.
Yes, those are both excellent points. And thank you, because as Dr. Casa, you said, there's no harm in you don't have to have heat stroke in order to require some cooling or be cooled. So.
And remember too, 100% survivability if someone's temp is under 104 within 30 minutes. Like, to me, that's super compelling that we need to find a plan to make that happen when possible.
Thank you. So our next question is directed to Dr. Casa. Can you describe intermittent cooling?
Sure. So intermittent cooling would be, for instance, in sports scenarios where, like, for instance, a football player during a game, offense comes off the field, they cool, they go back out 5 minutes later, they come back off, they cool again. So that would be someone who has constant exposure to a break period where they can get cooled. We're different from a soccer player with a 45-minute half, and at the higher levels of soccer, you don't really sub out. So they would just cool at halftime. So they might pre-cool, cool at halftime, and then maybe cool if there's before an overtime or something. So it's just everything's based on the confines and rules of the sport that we're talking about. Obviously, in practices and conditioning sessions, we make our own rules, and we should always increase the number and length of rest breaks when the environmental conditions are more extreme, or especially in the first few days.
Yes, and I think that goes to the point of making sure that you have the local guidelines when using wet bulb globe temperature, because they do stipulate how frequent those breaks should be, how long they should be, based on what the temperature, wet bulb globe temperature thresholds are.
Yep. Kim, let me add in one thing too, because We also can change the rules of the games and events. And the great example and the great role model, I think, is soccer. FIFA and US soccer, when it crosses the threshold, certain threshold for WBGT, they insert an extra rest break inside the middle of each half at the 30-minute mark and the 60-minute mark of each game. And so that they give them an additional break period to cool and to hydrate. So even at the highest levels of sport, when the environmental conditions are extreme, they modify the rule of the sport.
Thank you, Dr. Casa. That actually reminds me of, and this will bring me to my next question for Lieutenant Colonel DeGroot. It does depend on what sport, as Dr. Casa has said, because certain sports you have more equipment, so you need to start taking that equipment off before other sports that may have lighter equipment, which goes into my question for Lieutenant Colonel DeGroot. Is there anything being done in terms of evaluating or developing military uniforms and recreational attire to help mitigate heat? Understandably, there needs to be a priority on overall resiliency of the materials, but the t-shirts in particular seem to be stifling.
Yeah, no, that's a good question. That's so not that I'm involved with, but actually co-located. I talked earlier about USARIUM, the Army Research Institute of Environmental Medicine at Natick Labs. One of the other, call it tenant organizations up at Natick Labs, is some clothing and textile research stuff. So as we're looking at different uniforms and different fabrics, in fact, I'm sitting here, I'm wearing the Army's hot weather uniform. And if I change this out for my standard uniform I have at home, hanging in my closet, this is a lighter weight material. I don't know in terms of the actual thermophysical properties of it, how much cooler it is, but wearing it certainly feels a heck of a lot better than the standard uniform that like a trainee is issued. So they certainly do work in that. There is work in that regard.
Thank you very much. Unfortunately, we don't have any time left for more questions, but I do very much want to thank both our speakers for their excellent talks and just allowing us to engage and understand more on the hazards of heat, especially for our military and recreational communities. And at this time, I'll pass it over to Paul Schramm.
All right, thank you, Kim, and thank you, Dr. Casa and Lieutenant Commander DeGroot. Very interesting session, and interesting to hear about some of the research and things we can do to help protect this specific population. So we are nearing the end of the last day of the NIHHIS National meeting. Before we move on to the final session, we have one last poll question for everyone. So if we could get the link to the Mentimeter poll and the screen share up. One moment. So this final question will be forward-looking. So the link is in the chat. Everyone should be able to access that. It's the same system we've been using. So the last question on here is, what does a heat resilient nation look like to you? So we've heard a lot from a lot of different experts at all kinds of different levels, representing tribal health, local health from the city perspective, from the federal perspective, occupational health, military. So kind of putting that all together, and with everything that we've learned over the past 3 days, the question here is, what does a heat resilient nation look like to you? What comes to your mind when you synthesize all this information? So we'll give people a little time to type that in and discuss some of the answers. Okay, I definitely see equity and equitable popping up, making sure that we're focusing on and working directly with disproportionately impacted populations. Oh, a lot of great things on here. I see prepared and prevention coming up, and making sure that we're ready for extreme heat before the events happen. I see flexibility, innovation. Also awareness and kind of the communication part is showing up quite a bit as well. All right, great. And we'll definitely capture all of these ideas, but it looks like a lot of different ideas of what a heat resilient nation looks like. Again, to me, it looks like it's focusing on being the most resilient for the populations that are most impacted, and not waiting and doing everything as a response, but rather making sure we're prepared ahead of time. So thank you for that. And we will move into the final session, and I will turn it over to Julie, who will be going through the NIHHIS Strategic Plan. Thank you. Julie, take it away.
All right. So what a fabulous day. What a fabulous few days. It's pretty exciting. Part of the reason, I want to say thank you. We'll get thank yous again, but really just an amazing set of panelists and speakers today too. So part of the reason we did this word cloud and Mentimeter was to kind of get a vision of what you all thought was important and how we can build this vision of a heat resilient nation together. So NIHHIS is both a federal and intended to be a partnership group where we can actually come together, much as we've done today. One of the things we are doing, and we've heard throughout the chat, okay, what are the solutions to what we do, but also how do we get there? So within the federal family, we are actually planning we're in the middle of a strategic plan, and this was also time to kind of learn from you all here. So I'm just going to step through pretty quickly in about 10 minutes or less at the end of the day of a long series of really interesting talks. So I will be pretty high level and brief and say that this is just a way to let you all know this is what we are up to, and what you can expect to see at some point in the future, and how to, what to expect from us in the next few months. So next slide, please. Thank you all for still being here too. This is great. All right, so strategic planning, we've heard throughout the course of the meeting is the solutions, meaning both what are we going to do and then what are we actually going to do and implement. And this is a process of helping us do both of those. How do we organize ourselves? NIHHIS, you heard before that heat, and I think we've seen in some of the cities that it doesn't necessarily fall in any one place. So we've heard on different levels how communities and cities and the federal agencies through NIHHIS are coordinating this. So this is a plan to kind of help us align ourselves, figure out what we're going to do and how to prioritize. And that's the basic point of strategic planning of any sort. Next slide, please. So this is a little bit about where we are. You'll see number 4, NIHHIS National Meeting. That's where we are today. We have a retreat, a federal retreat planned for the middle of May, where we will be going over in much more detail this plan. But I do want to say that part of what we are using as a basis of a plan is a lot of the contributions from you, because NIHHIS, if you haven't gathered it yet, NIHHIS is about partnership, and you'll see that again in the plan. So we sent out a survey to many of you, and you filled that out about, I can't remember how many questions, but a fair number. And we actually worked with the Lynn Carbone and Associates to do some of the synthesis and building the plan based on the input from all of you, and then some of our own input about what we felt we needed from our agencies. So that is our starting point, and it's based on what we heard from all of you, fed, state, local, tribal, a few international partners as well. So that was our starting point. That's what's gone into what I'm about to just preview for you. We will be discussing that in more detail as the federal agencies in May, and then get a draft plan for review. We're not quite sure exactly the process for review and input, but there will be some opportunities for y'all to provide some additional input. But as we've said throughout the meeting, some of the Mentimeter questions, the questions we asked in the sessions, we're listening. We actually have a note taker here through the whole time. So we are not in an attributable way, but we're catching to make sure that we've heard you, and some of the most important issues and gaps. And I've already learned about some populations that were not even kind of in the mainstream of considered disproportionately affected. So interesting. For us, we will be then turning that strategic plan into what are we going to do in the next 1, 2, 3, 4 years. And then obviously there will be some ongoing process for updating that and, getting budgets and that sort of thing. Okay, next slide, please. All right, so here's where we're going to start. The vision and the mission. What do we want to see? A world free from heat-related illness and death. Pretty good goal. We have a U.S. part of that, but we also have heard from some of our international partners and some of our U.S. colleagues who work internationally, and obviously we have citizens and interests at home and abroad. So I think that's a a pretty cool vision, but that might change, but that's what we're going for. We've heard that most heat deaths are preventable, so let's do that. Let's do that. We also heard from you that equity and justice were primary throughout this. We saw that in last word cloud. That is an underpinning throughout the entire plan. And so I'll go through the steps, and then each one of them actually has an equity and justice underpinning to it. So the mission, building understanding of extreme heat problems from day one. Are we getting the message out? Do people really get that this is a big problem and why? What is the demand? What do we actually need to do? What do folks on the ground, whether you're tribal or local or a community-based organization or an NGO, what do you actually need? What is the science-based product and service delivery? What do we actually need to produce and do and research to actually get to that point? How do we build the right capacity? How do we enhance what's already going on? How do we support those of you who are already at the forefront? How do we help those who are trying to get there? How do we communicate it with the end goal of informing decision-making that, again, reduces heat illness and death? So that's the mission and the vision that we're working with to start. And again, these are all draft, but so we're just going into our process, and just wanted to let you know that's kind of where we're headed. Okay, next slide, please. So we divided all this amazing input. We had like 100-page report from all of the input we got from you all. So thank you. If you filled out the survey, we actually really took it and we really listened to it, and we're diving in super deep into that. This is a very high level, our attempt to kind of roll this up into 4 main goals. Now, NIHHIS is an integrated information system, and the fundamental principle is driven by understanding what users need, where they need, when they need it, what they need, what time scale, what resolution. Like, that's the whole point. So goal 1, I mean, first you have to exist. Like, we're, as you've heard, across missions and mandates, no dedicated funding and all that. And also really like establishing this partnership, defining the demand groundwork. So that's it could either be goal 1 or goal 4. It's, how you start or finish. You can do all these others, but you have to exist. You have to have your structure and your framework and your partnerships before you can actually do a lot. Goal 2 is really understanding what you need, how you need it, from meetings like what we're doing today to, Lad, Keith, and the folks in Arizona, Dave, Angela, both had an Arizona extreme heat meeting on Monday right before this to really understand what was going on in Arizona, what had happened before. It involved our weather forecast offices and many of you actually. So really trying to figure out how best to serve and support the state, local, as well as the national level capacity that we are responsible for. So you'll see an inspiring national level commitment. That doesn't mean federal only. It means what can we do on the federal scale that helps the rest of you also do what you're trying to do at the scale at which you're working. Goal 3 is collaborating on the research side, whether it's applied or foundational. We've heard a lot about needing to understand the character of the heat season, longer lead times, better planning in advance, longer time scenarios. So really kind of there's a research and product development piece here that the end goal is, of course, sustainable and societal resilience to heat. And then goal 4 is making sure that information, the suite of tools is out there, that we're communicating it. This is things like our national portal. It's also decision support products and services, some of the tools that you heard today in the session, the hands-on session. So really getting information out, acted upon, and then learning from that. So that informs the research and the observational networks and the surveillance systems and the like. Next slide, please. I'm going to go quickly because I know we're a little bit behind time. So I just want to do a little bit deeper dive on each of these. So goal 1 is really like the mission dependencies. What does it take to actually function? What are the partnerships? But again, this partnership piece isn't just a list of names. It's really foundational to some of the other pieces. So we list it here, but the depth and the breadth of it's really a bit later in the strategic plan. Next slide, please. Goal 2, this was the one about really understanding the societal needs and context. So you can see the different areas here. This is like a meeting like this is one of the ways in which we can do this. And some of the deeper dives that we're planning on doing afterwards are ways we can really make sure that we are understanding who needs what and when to take the right action at the right time. And making sure that we are, as Paul said, as you guys did in the word cloud just now, but throughout the time, let's not just do the response. Let's do a better job of preparing and enhancing resilience, whether it's community or, individual human resilience, as we talked about today. Next slide, please. So goal 3 next slide. There you go. Are we stuck? Goal 3 is about research. Making sure we're there. Did you all freeze? I'll just keep going. So slide 3. Okay, well, I guess I'm the only one that doesn't see slide 3, goal 3. All right, so that one.
We can hear you.
Okay, all right. I'll just keep going. So goal 3 is the research collaboration piece, but that's also where like the decision science, some of the pilot projects. So, you know, depending on what we're trying to learn and what new populations we're trying to reach. We heard a lot about mental health and maternal and child health. Like, how do we get started on that? What really needs to happen? What kind of research, what observations, what kind of forecasts, what kind of surveillance systems, that sort of things. How do we integrate them? That's kind of the fundamental. Something weird just happened. You all disappeared and came back. I've been on all day. Can you hear me still?
We can hear you.
Yes, we can hear you. Okay. I don't know. That was weird. And then the fourth one is really facilitating the integrated approach. We're on goal 4, please. So next slide. The integrated approach to providing information. So this is things like the portal and the mitigation, adaptation tools and strategies, and really communities doing things on the ground, whether you implement cool cities or tree planting, and a lot of the things we've heard about over the last few days, like what do people do about it, and how do we actually communicate and learn from each other on the doing and the making and the moving further, faster, and protecting people better sooner. So this is really where the rubber meets the road. Okay, next slide, please. Try to make up a little bit of time here because we don't want to keep you all too much longer, but that gives you a high level view of like where we're going from defining the partnerships based on what communities we're trying to serve, what is the demand, what are the research needs, what are the information communication decision tools, how do we actually apply it, how do we learn from that application so that it helps drive the research questions. It's not an unheard of model for doing a program or a strategic plan, but it has so many layers. This is a federal oriented plan that it's designed to really integrate the rest of the communities here. Everybody that's represented here has a piece in that plan. NIHHIS has a partner network designed to really help us, have a pathway and a sustained engagement with the non-federal partners, of which you all here. I'm really grateful. So I'm going to leave with a few. So that's it for the strategic plan. We will be in touch with a way to be involved in a review. We're not quite sure exactly how that's going to happen, but once we get a draft plan, there'll be a chance for you all to provide some input on that. And I wanted to leave though with a few more tangible things that we are planning to do that you can expect to see from us. And we hope to hear from all of you regardless anyway. Obviously the strategic plan. You heard before in the sessions yesterday, we have an upcoming communication social media campaign for the heat season. So if you are working on a media campaign for the upcoming season, let us know. We can work together, amplify, coordinate. You can use some of the products that we're going to use if that makes sense. We also heard in a very fun way, Dr. Spinrad announced our urban heat island campaigns. Those will be going on over the summer with our first 2 international cities. We do have an updated NIHHIS portal coming, which is where you can come and find a lot of the agency resources in one place. So you can still go to each agency and find most everything, but it gives you a common portal with everything from the forecast to the adaptation tools and guidance documents and that sort of thing. CDC is refining its heat and health tracker, so it'll include daily heat-related illness and surveillance data. We do have a webinar series on overlooked and overburdened populations that'll be coming up. We're planning about one a month. We do want to have a process for feedback on some of the tools and products like the one that Dr. Balbus mentioned, and the heat and health tracker. So we have this new climate health outlook. So we'll be looking to you all for some feedback on that. And then we already know that we have committed to doing some much deeper dives on innovation and communicating the heat health problem. We definitely focused on the near-term communication. So we're doing a deeper dive on things like how to involve art and science community, the futurist sort of photo essay competitions, all kinds of more innovative things on the communication problem. We already from the indicators coffee hour and for the heat from the international one know we need a much longer conversation on those. So we'll be doing at least those 3 and maybe more. And with that, I want to just ask that you'll see a place on the last slide to sign up for the digest. We know how to find you, and we will be following up with you on those things. So at this point, that was a pretty fast and furious tour to catch up, hopefully a little bit at a time. But I think at this point, I want to just make sure that we have a chance to thank all the people that need to be thanked. And it starts with you. So I will thank you for being here and for being here still. And I will turn it over to Kim to help us round out the rest of this meeting and close us out. Kim, over to you.
Thank you. Thank you, Julie, and fantastic job in giving that overview. And as Julie said, we want to thank everyone for attending the first NIHHIS National meeting over the course of the past 3 days. And we want to thank the agency's leadership who were able to provide comments and support, not just for this meeting, but for their continued support of NIHHIS. I want to thank the incredible speakers, presenters, and panelists. Not only have they informed us on a variety of topics regarding the vast problem of heat and health, but also for connecting us and bringing forth discussion points we'll be able to continue working on together in this network. I'd like to also acknowledge the great work of the CDC Environmental Health Nexus team, Jonathan Lynch, Myron Douglas, Katrina Kramer, Christopher Naylor, and Renee Leach. Continuing acknowledgements for our steering committee members, Dr. John Balbus, Mitchell Berger, Arthur Craig, Miranda Daly, Dr. Brenda Jacklitch, Maggie Jerry, Hunter Jones, Victoria Ludwig, Rebecca Moulton, Dr. Danielle Nagel, Lynn Owens, Dr. Thomas Osborne, Dr. Shabayu Saha, Paul Schramm, Nick Shufro, Dr. Ashley Biednik Tabasco, Dr. Augusta Williams, and Morgan Zabau. Special thanks to Dr. Shabayu Saha, Hunter Jones, and especially Morgan Zabau for all their tireless and creative behind-the-scenes work to allow this meeting to be executed as smoothly as it has been. Kudos and thanks to all. And I want to note how instrumental Morgan has been getting us all to this place, this meeting, and ready to step forward together. So with that said, I'll pass it over to you, Morgan, to close us out. Thank you.
Thanks so much, Kim. There my camera is going. I first want to mention again that the slides and video recordings will be available on our website, and we will email all attendees when they are ready to go. I want to echo the sentiments in thanking everyone who made this event possible, from, again, our wonderful speakers, moderators, panelists, and keynotes, to the NIHHIS National Steering Committee, to Lynn Carbone and Associates for all their help, and of course, to our amazing team behind the Zoom cameras, the CDC Nexus team. Finally, I want to thank Kim McMahon, Paul Schramm, Hunter Jones, and Julie Turton for their leadership in not only making this meeting successful, but for all of the time, effort, and passion they've put into addressing heat and health through NIHHIS. And thank you to all of you who attended over the course of the 3 days. It's been so inspiring to see so many people who care about addressing heat and health, and we hope that NIHHIS can help you with these efforts. Make sure to stay tuned as we're just getting started. And with that, I officially close out the first NIHHIS National meeting. Have a wonderful rest of your day and week.